let me know, when I share my slide,
Okay.
Starting time. I'm talking in my office, university.
Oh.
No way out.
Yeah, your virtual background is very beautiful, Professor Lee. Yeah.
But now it's the hot summer.
Oh.
We have very extreme fall season, very cold and cold winter, and now it's hot and sometimes very scorching day,
Okay, yeah. Yeah, in Korea, in winter, it's very cold.
Yeah, so snow. But the global warming, so the winter period is getting shorter.
Yeah, I see. Okay.
Global warming, that is big issues.
Yeah, so the winter already finished, yeah, Professor Lee.
Yeah.
All right. I'm sorry, Professor Agung.
Okay.
I think we will start soon now.
Okay.
Okay, thank you. All right. Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. Greeting to all of us, to the Honorable Dean Faculty of Pharmacy, Universitas Gadjah Mada, Professor Dr. Agung Indro Nugroho, to the Honorable our today's speakers, Dean of College of Pharmacy, Ajo University Asian Association School of Pharmacy, Professor Bom Jin Lee, and then we have Deputy Program Director of Bachelor of Science in Pharmaceutical Science, Department of Pharmacy, Faculty of Science, National University of Singapore, Dr. Yao Weiping. And then we have Professor at the University of Applied Sciences and Arts, Hanover, Germany, Professor Dr. Gerard Furtwängler. And then we have Professor of Pharmacy Education Practice and Policy, University College London, UCL School of Pharmacy, Professor Ian Bates. And then we have the Senior Lecturer, Faculty of Pharmacy and Pharmaceutical Sciences, Monash University, Dr. Ian Larson. And then we have Senior Project Manager, PT Bio Farma, Dr. Nini Nuraini. And to the Honorable all the lecturer and the webinar participants. Good afternoon, ladies and gentlemen, and welcome to today's webinar on adaptive pharmacy education curriculum. My name is Farida Nur Aziza. I'm a faculty member here at Faculty of Pharmacy, Universitas Gadjah Mada, and will emceeing this webinar today. And before we get started, I'd like to explain the schedule for today's webinar. The first agenda will be the welcome words from our Dean Faculty, and then we have the second agenda is the first session of the webinar, and which will be followed by an afternoon break. And then we will continue to the third agenda is the second webinar, and the last agenda is closing. Well, if you have any question during the presentation, please type them into the chat box. And to keep the quality of the functional during the meeting, please mute yourself when you are not sharing. And then we will move on to the next agenda. We will have a welcome words from Dean Faculty of Pharmacy, Universitas Gadjah Mada, Professor Dr. Agung Indro Nugroho. To the Professor Dr. Agung Indro Nugroho, time is yours.
Yeah, thank you very much, Ms. Farida Nur Aziza, for your time. Assalamualaikum warahmatullahi wabarakatuh. Good morning, ladies and gentlemen, Your Excellency, Executive Board of Faculty, Departments, Programs, and Laboratories in the Faculty of Pharmacy, Universitas Gadjah Mada. Distinguished guests, invited speakers, and all participants. First of all, on behalf of the Faculty of Pharmacy, Universitas Gadjah Mada, It is our great pleasure to welcome you in this afternoon to the webinar on adjunctive pharmacy education curriculum. The webinar is organized by the Academic Innovation Unit, the Faculty of Pharmacy, Universitas Gadjah Mada. The webinar aims to serve as a discussion forum to develop an adjunctive pharmacy education curriculum. Ladies and gentlemen, for your information, pharmaceutical sciences is developing very rapidly, and we are currently dealing with the Industrial Revolution 4.0. We need to focus on expanding new literacy, for example, Internet of Things, big data analysis, soft skills in pharmaceutical education. We have to prepare the concepts and systems of our pharmaceutical education to produce graduates who are agile and adaptive. If pharmacists have agile and adaptive characters, they will survive in the era of the Industrial Revolution 4.0. And they can increase the professionalism and access of pharmacists in workplaces. Ladies and gentlemen, one of the efforts is to hold a discussion related to the topic. On this occasion, ladies and gentlemen, we invite great and extraordinary speakers and experts from abroad. The first is Professor Byung Jin Lee. He is Dean of College of Pharmacy at Jeju University. He is my best friend from Korea. He is the president of ASEAN Association School of Pharmacy. He would like to present about pharmacy education 4.0 in Asia. Second speaker is Dr. Yeo Wai Ping, Deputy Program Director of Bachelor of Science in Pharmaceutical Science, Department of Pharmacy, Faculty of Science, National University of Singapore. She would like to explain us about distinct characteristics of pharmacy and pharmaceutical science education. Next speaker, third speaker is Professor Dr. Gerhard Furtwängler. He is from Hannover University of Applied Sciences and Arts. He would like to share about challenges and future trends of public health education in Europe. Fourth speaker is Professor Jan Pitts. I think he is very famous, Professor of Pharmacy Education Practice and Policy, UCL School of Pharmacy, and he is also Director of Education Development for the International Pharmaceutical Federation, FIP. He would like to give us a topic with title of Development of Future Pharmacy Education Curriculum. Fifth speaker is Dr. Ian Larsen, Faculty of Pharmacy and Pharmaceutical Sciences, Monash University, Australia. He would like to explain about digital learning application platform for the pharmaceutical industry. It is very, very interesting. Sixth speaker is Dr. Neni Nuraini. She is Senior Project Manager, PT Bio Farma. She will share the experiences about recent progress of biomacromolecular research in industry. Ladies and gentlemen, the 6 speakers above are great and extraordinary speakers, but the next one is just an ordinary person. The next speaker is me. I would like to present about pharmacy education in Indonesia and share the implementation of independent campus and freedom to learn, ladies and gentlemen. And finally, I wish you to enjoy your time during the workshop, and thank you very much for your kind attention and cooperation. Billahi taufiq wal hidayah. Wassalamualaikum warahmatullahi wabarakatuh. Good afternoon and success the webinar. Thank you very much.
Waalaikumsalam warahmatullahi wabarakatuh. Thank you, Professor Agung, for the greeting. And now, without further ado, we will turn the time over to the first session of our webinar, which we are waiting for. In this session, we will have our amazing speakers. The first speaker is Dean of College of Pharmacy at Jeju University. He is the President of Asian Association School of Pharmacy, Professor Byung Jin Lee. And then we have the second speaker, the Deputy Program Director of Bachelor of Science in Pharmaceutical Science, Department of Pharmacy, Faculty of Science, National University of Singapore, Dr. Yao Weiping. And then the professor at the University of Applied Sciences and Arts, Hanover, Germany, Professor Dr. Gerard Furtwängler, and Professor of Pharmacy, Education Practice and Policy, University College London, School of Pharmacy, Professor Ian Bates. And this session will be guided by our first moderator, Professor Dr. Triana Hertiani, the Vice Dean of Faculty of Pharmacy in University of Gadjah Mada. So, Professor Dr. Triana, time is yours.
Okay, thank you very much, Ms. Farida, for the brief introduction. Ladies and gentlemen, good morning, good afternoon, good evening. Assalamualaikum warahmatullahi wabarakatuh. Thank you very much for joining us in the webinar of Adaptive Pharmacy Education. This webinar is organized by the Faculty of Pharmacy, Universitas Gadjah Mada, in celebrating its 75th anniversary, and also as a kick-off of what has already been explained by our deans, the independent campus freedom of learning, which has been initiated in our faculty within this year. So, ladies and gentlemen, I'm Triana, and I will be the moderator for the first session. As we also already know that pharmacy and pharmaceutical sciences is the fast-growing disciplines, and it's already have been mentioned by Professor Agung that in the time of Industrial Revolution 4.0, it has so many changes and which disrupt many aspects of lives, and that's also affect the pharmacy and pharmacy education. So there's arisen many discussion and also concern about what kind of competence can be required, and also what kind of profession will survive in this era and in the next 10 and 20 or 30 years from now. And it's our obligation as pharmacy educators to make sure that we provide our students with the best suitable atmosphere for them to develop themselves, to transforming themselves into a future leaders by being adaptive, being relevant to the situation, and giving a best impact to the society and science. So I'm sure that everyone is looking forward to hear and to learn from the sharing experience and expertise from our valuable speakers this afternoon in order to design the best curricula for our pharmacy education in each of our institution. So without further ado, I would like to invite our first speakers from this session, Professor Byung-Jin Lee from he is the president of the Asian Association of School of Pharmacy. Good afternoon, Professor Lee. How are you?
Yeah, how are you?
Thank you. I'm fine. It's such an honor to have you here. Thank you for accepting our invitation.
Yeah.
Professor Lee is a dean and a professor in the College of Pharmacy at Ajo University, but he's also the currently is the president of the Asian Association of Schools of Pharmacy, and also he awarded his bachelor and master degree from College of Pharmacy, Seoul National University, Republic of Korea, and he awarded the PhD from the College of Pharmacy, Oregon State University, Corvallis, USA. His research interest is more about the pharmaceutical sciences and drug development, but he's also interested in pharmacy practice and outcome-based education system. So I think everyone is looking forward to hear from Professor Lee. Professor Lee, the time and the screen is yours for the next 30 minutes. So please, time is yours.
Thank you for introducing me, Dean Agung and Professor Triana. Selamat siang.
Selamat siang.
Yeah, selamat siang. Thank you. I'm share my slide. Can you see my slide?
Yeah, we can see it clearly.
Yes, very clear.
Okay. Just maybe pointer. Okay, the title is simple, but a little bit bizarre because for 4.0, it's actually the meaning the industrial the revolution 4IR, the name it. In the front part, I introduce the traditional role and the function of a pharmacist and pharmacy education, and thereafter I extend my talk to how melt this fourth industrial revolution in our outcome basis or competence basis pharmacy education.
Professor Lee, I'm sorry, is because we still can see both of your slides. It's maybe it's possible to.
Okay. How can just me?
Maybe.
Let me see.
Okay.
But when I change that the two slides come together.
That is okay.
But yeah, it's. I think
it's okay, Professor Lee.
It's okay.
It's okay.
Yeah.
A little bit. This is my first experience. A little bit confusing.
Yeah, no problem.
Okay.
We still can see very clear.
Yeah.
Actually, according to FIP and WHO, there are so many roles of pharmacists is defined in different categories. You may get used to this area of pharmacist role in mainly patient and prescription care, receiving prescription, checking, and providing information, advising to prescriber, even maintaining file recording, also advising patient, so many things is going on in patient care side. And also administration services, supervising and coordinating, and also collaborating with other healthcare professionals. So mainly in pharma industry, focusing on drug product control and management, storing, preserving vaccine and other drugs, and labeling or developing information and risk of particular drug or testing. So many roles of pharmacists in pharma industry in terms of QA, QC, and regulatory issues as well. Finally, in academia or industry, main drug discovery and drug product development. So you get used to main this role of pharmacist. So this is a little bit 2016, I collect some the education system from all Asian countries. depending on country to country, the length of education period a little bit changeable from 4 year to 5 year, 6 year, even 6 year, 2+4 or 4+2 is a little bit very complicating. This one also.
Professor Lee, maybe would you try to click on the second icon from the right on the bottom? Yeah.
Now
this
okay.
the one with the no,
slideshow. I don't know. Oh, it comes on every time.
No, it's from this.
You are seeing 2 slides.
Yeah.
At the same time. But my main monitor.
Okay.
This is very rare.
So there's a icon in your screen below.
Yeah. I got left. 2 when I got slideshow. It's the two slides.
Okay, it's okay.
Let me check. This is my first experience. Anyway, I don't know how to do that. Okay, sorry for inconvenience anyway. Yeah.
It's okay.
It's okay.
I'm sorry for disrupting.
Okay, so the pharmacy education system and licensure in Asia is very diverse. You know, like here is some including United States. FIP is one of main organization to help us for global level of pharmacy education. They develop some FIP developed goals over 21 sectors, and each, the goals give us very extensive and future pharmacy education where it goes. Recently, FIP digital health in pharmacy education are very focusing and also supplying the webinar for the pharmacy school. Also, the sub-body of FIP AIM, that's academic institution members focusing on the education mainly. That's they get attention to share some global standard information about the pharmacy education. In that manner, they suggest so many curriculum and information and where the global standard education go in terms of the practice, curriculum, leadership, and so on. Also, communication globally, and also share the pharmacy education. Also, the FIP AIM, so it's a connectivity country to country and school to school to become interconnected on a global level. So there are many the sub goals to focus on these fairness and connectivity of pharmacy education. PFAP also 2012 is defined the pharmaceutical scientists and pharmacists, what the pharmacists, what the pharmaceutical scientists. So normally pharmaceutical scientists is, is prepare the necessary competencies, or they can innovative or develop new drug, new medicine, and dosage form. Pharmacist roles that I mentioned before is compromising very diverse roles and activities. That is defined in 2012 by FIP to improve global health by closing the gaps in the development and distribution and responsible use of medicine. AASP also 20 years ago is founded 2001. So the headquarters registered in Singapore. And until now, so you have many conferences and education forum as well on the purpose of to serving its members and schools by acting their advocate and spokesperson at the international level by providing forum conferences and also recognizing outstanding performance, assisting member schools in meeting their mission of educating and training pharmacists and pharmaceutical scientists as well. So our organization AASP activities over 20 years, every year you got biennial conferences and pharmacy education forum. Because of these, organizations, so there is no doubt that also AASP is a good organization in Asia to make better pharmacy education and practice, and the research is to be harmonized at the global levels. Now we have to at least mention the fourth industrial revolution. That's the first industrial revolution, mainly steam engine, industrialization and urbanization before 2 centuries ago. But second industrial revolution started the early 20s and mainly electricity sector. But the 1970 third industrial revolution emerging, so focusing on the digital computer, internet, and communication technologies. But it's mainly closed system. But the actually fourth industrial revolution going on in the meanwhile, third industrial revolution going, but just mentioned in Davos Forum in Switzerland 2016. At the time, the fourth industrial revolution, 4IR, is a fusion of innovative advances in AI and big data and robotics and internet, IoT and 3D printing and nanotechnology. There's no doubt there's so many things is melted and combined. That's 4IR also mentioned that is an era where offline and online completely coincide. And also these 4IR technologies that converges boundaries of the digital, bioindustry, and physics based on the ternary industry. And finally, virtual world and real world become one. That is the very diverse definition of 4IR. So mainly people focusing on that 3D printing, AI, big data, VR, the eco-business, and so on. So in this situation, how the university is changing according to these 4IR environment. I'm sure some other universities where it go. For example, Stanford University, they innovated more than 15 years ago, and they changing education system, not simply teaching and learning. They suggest a project-based learning system in 1993. Actually, these 4IR mentioned. And also they got the collaboration of industrial and academic projects solving actual problems. They supply these education infra for the students. So before the university, just people, students stick to the textbook and good solution, no innovative and no creativity. However, because of that, the education here changing, teaches students how to learn on their own. So directly from reality, or learn how to learn. So, or practice team project, or learn how to work with others, not stand by themselves. It's get together. And also, professor is not simply expert. They just coaching and harmonizing student to students. They got more learning or get more practice in education. And also the École in French University suggests very challenging system. They have no any professor, no lecture, just self-learning, and also training of communicable type of talents through team play, teamwork. Also coding and train students like artists, not simple technician. So everything should be done by robot or AI computer. So automation is everywhere. The students must be more talented in future education. So in other words, students must raise their inherent human competencies. What is competencies? Such as creativity, like art, or interaction with people, or empathic ability. So because everything should be done by AI. And finally, the Olin, the Boston University here. So the education, they learning the way to learn is through project-based system. So also they cultivate some talented experts through converged education. So many education tools and fields, idea. So connecting together to be able to learn more. And also cultivating innovator through teamwork. So also train talent needed by the market, not closed in the campus inside. So more open innovation with other outside campus is company or society that need more advanced knowledge and education. So if these kind of slides suggest us the university and even pharmacy school should be innovative, but how? Normally pharmacy school just get to the more knowledge basis education to be a pharmacist after passing the national license exam. So do we accept these innovative education paradigm and changes for future pharmacy education? Once I tried 4 years ago, I suggest this kind of education in my schools. But students evaluate my lecture at bad score. I pay the tuition, so I want to learn more. But why do you push me to present at the podium? Also, why do you just share without teaching us at a certain level of knowledge? Something like, they want me to be a AI or just a knowledge provider. So I stop at the moment. I should be patient until my students get more innovative or recognize these education environment. So even students like that, the society is going, it's drastically changing. The future society go at the 4IR. So robotic pharmacist comes, 3D printing liver, or other so many personalized or information drastically going up through SNS, or you are generating whole bunch of big data. It's a data dumping, in the society. So even you cannot memorize so that the job, the distribution is drastically changing. Some job is fading down. Some job is emerging. In general, simple job is going down, but more creative, more innovative business is going up. So under this situation, so some scientists suggest in future, for example, AI going to lead to the full understanding of human biology and give us the means to fully address human diseases. All this AI based on big data, not simple big data, is a very good quality of data, no partial information or balanced information in humanity or ethics as well. Also, researchers are deploying AI to discover drug and computer calculated compound, not simply, so all based on lots of physical, chemical, biological, toxicological, pharmaceutical information, get checking and using AI, give us more better chance to save time and cost in future education, drug discovery and development. So the role of AI based on the good quality of data, a very good driving engine in drug discovery and drug design or synthesis or polypharmacology, even drug positioning. So still this, big data and AI is spread in our society. So many global company is using this, AI, to development or to diagnose diseases. So this one is very good to save cost and time in drug discovery and development. Oh. It's a bunking. Oh, sorry.
Yeah, can I help you, Professor?
Yeah, it's
Something happens.
Suddenly it's stop it.
It stopped.
Yeah,
But
so many
good thing
trouble.
is, but the good thing is now we can see only the one slide of yours.
Yeah.
Okay, sorry.
No, it's okay. Maybe we can close for a while and then try to continue.
Maybe I want maybe less than 10 minutes, something, but suddenly, okay.
Maybe you can stop.
Yeah, no way, yeah, sorry. Yeah.
No, it's okay. The slides.
Yeah, I don't know. Let me check again. Okay. Oh, this is my first time. That's for.
Or maybe we can help you by sharing the files from our side.
Yeah.
That
okay. Now, can you see?
yeah, we can.
Okay. Maybe got there. Okay. Now, it's done.
Yeah.
So under the 4IL environment, so how the pharmacy education paradigm is shifted. So I think the College of Pharmacy is transformed here human resource development organization with the competencies to serve these so many unmet needs of healthcare society. Also, education, the paradigm shifting for future-oriented education, actually outcome basis. So, in other words, professor-led curricula changed to student-centered education, and and that means curricula is important, not what the professor teaches, but what the students should learn and comprehend. Also, reflect and try to satisfy so many social unmet needs and measure the specific performance of students and put students' needs in the front and the center of learning design process. Based on this environment, the education mission, goal, and focus on student-centered and patient-centered outcome basis, put people first. Actually, that word is, suggested by UN. Also, we get the value chain responding to social unmet needs. So, in order to outcome-basis pharmacy education, there's a four core competence categories. One is planning for the future, more creative or flexible or innovative thinking and planning. That's one side. Another is the basic knowledge that's on School of Pharmacy, including industrial pharmacy, clinical pharmacy. And also on the right side, more professional is a major area. So analytical thinking and critical thinking or decision-making. Yeah, pharmaceutical science requires so many go or no-go decision-making and clinical skill and so on. That is a more professional basis one. On the left side is a more relationship basis because pharmacy education, require this relation basis, the curricula, because pharmacist is the contact so many very diverse patients and people. So you got more ethics basis or communication and collaboration and so on. So this is poor core curricula that is our university and many schools is focusing on these mission and goals is on hospital pharmacy practice and community pharmacy practice. Also, we are collaborating inside the campus for hospital pharmacy practice, directly dispensing drug, automation, or septic preparation is going on. And also EMR data. So all students must, understand or that EMR reviews inside with the medical doctor in the university. But what is the good quality of pharmacy education? In other words, it must, meet these so many, the 4IL information for the outcome basis pharmacy education. However, the education system in the country to country is very diverse. Also, education infrastructure and also disease type, main focusing disease in Africa, Asia is different, and culture, also economy as well. So based on these environments, how do we drive good quality of pharmacy education? Here, I got some information. So linking the 4IL digital transformation. So the pharmacy school more competence oriented or performance oriented, and knowledge is practical relevance. So in order to do that, fundamentally you change all usage method and tools together. Yeah. Also, the education environment is a COVID or pandemic or telemedicine or on-tech. So we must adapt these changes of education environment in the curricula and the content of pharmacy education. Also, the shift to the paradigm of pharmacists, not simply dispensing, rather than dispensing, to providing pharmaceutical healthcare services in research and education. And also 4P, yeah.
I'm sorry, maybe can we finish in around 2 minutes maybe?
Okay, so this one based on digital transformation. So we building more competence basis pharmacy education in the building future skill and recommending medicine. In the community pharmacy is building a data headquarters at the fourth industry. So keeping the data, building a base center, accumulating, not simply dispensing medicine. So also establish a base to monitor how the medicine are administered to the people. That's a community side, and the future-oriented curricula in the university, the education program and everything in more challenging using 4IL technology in the lecture or virtually or offline, even metaverses environment should be melted in the pharmacy curricula. However, all the pharmacy education based on legal basis. So you got the licensing, not simply testing knowledge, but more you testing competent basis, national pharmacist exams. Also, the university school must be accredited, should be legalized accreditation. And finally, you must change the the reform in the law to apply these 4IL environment. Okay, so in future, you got so many pharmacy education support to be a good future pharmacist, in this area. And also United States is more competence-based dual degrees is, many universities going on. However, this is final slide. Every environment is gradually changing, innovating. So our education system must be assessed and then to change to meet the future unmet needs in terms of infrastructure or curricula or education process made WHO, FIP, AASB should be a good organization to supply this enormous information for future pharmacy education. Okay, thank you. That's maybe I skip slide this. All these maybe my talk, maybe summarized in this conclusion. Sorry for inconvenience. Actually, my graduate students said, but a little bit conflict in learning my slide. Oh, thank you for your kind attention. Yeah.
Thank you very much, Professor Lee. And sorry to interrupt you with a very interesting presentation. Okay, for everyone, audience, if you have a question, please type it down in the Q&A box at any time. And because we have a very tight schedule, thank you very much, Professor Lee. I think there are many questions will come up later on, and we continue to our second presenter from this session, Dr. Yao Wei Ping from the National.
If you don't have any question, maybe also send emails. I'll kindly answer to that.
Okay,
maybe let my email to anyone who got.
I think that will be great. Yeah.
Thank you.
But would you stay the whole?
Yeah, I'm stay here, but on and off a little bit. Yeah, but I'm keeping on this webinar.
Okay, thank you very much, Professor Lee. Okay, so I would like to invite our second speakers, Dr. Yao Wei Ping from the National University of Singapore. Good afternoon, Dr. Ping.
Hello, good afternoon, Professor Triana.
Nice to meet you.
Nice to meet you too.
Thank you for accepting our invitation. Ladies and gentlemen, Dr. Yao is a lecturer and researcher at the Department of Pharmacy, Faculty of Science, National University of Singapore and US. And she received both her Bachelor Science of Pharmacy and a PhD from NUS. And then she continued the postdoctoral fellowship at the Harvard School of Public Health. And I think because we have a very tight schedule, I think we are looking forward to the presentation from Dr. Wei Ping. So Dr. Yao, the time is yours.
Thank you. A very good afternoon to everyone. Thank you very much to Professor Triana for the kind introduction. And thank you very much to Professor Agong as well for this opportunity for me to share on the distinct characteristics of the undergraduate pharmacy and pharmaceutical science programs at the National University of Singapore. Our Department of Pharmacy at NUS is the only pharmacy school in Singapore. We have a long history of 116 years, and we pride ourselves in being excellent in our expertise and continue to be ranked highly in the world in terms of pharmacy education and research. At any point in time, we have approximately 1,000 students housed under various undergraduate and postgraduate programs. Of interest to the audience and for today's presentation, I will be sharing on our flagship undergraduate professional pharmacy program, which is the Bachelor of Pharmacy Honours Degree Program, with a new curriculum starting last year in 2020. In addition, I will also be sharing on our boutique program, the Bachelor of Science in Pharmaceutical Science Honours Degree Program that was launched in 2018. Let me start by sharing with you our Bachelor of Pharmacy Honours Degree Program. Our new curriculum leading to a Bachelor of Pharmacy with Honours is 4 years in duration. Instead of a thematic approach that runs longitudinally, we now have an integrated curriculum that builds on the foundations in science and professional identity as a starting point. After which, the bulk of the curriculum will be delivered in the form of a system-based approach. Throughout the 4 years, and especially in the final year, there will be continuous exposure of experiential learning, where students get to work with pharmacists on the ground to understand real-world situation and taking that knowledge back into the classroom. There will also be a compulsory discovery project as a capstone work for the students, as well as a 6-month-long internship in different work settings as a final touch point before students go out to the world. Upon graduation, our graduates will then undertake another 6 months post-course pre-registration training internship, at which point graduates will go through a professional exam and licensing administered by the Singapore Pharmacy Council to be registered as a pharmacist. Our graduates will then continue on their lifelong learning journey as a healthcare professional. Let me share a short introductory video clip on the curriculum highlights of our Bachelor of Pharmacy Honours Degree Programme.
Your learning will take place not only in the classroom and laboratory, but also in the community, where you will meet and work with real health professionals and healthcare consumers. The workplace and classroom activities will allow you to understand what you are learning better, and you can also practice what you have learned in the classroom when you go on the attachment. Such learning activities where you are supported in every step of your learning from year to year ensure that you acquire the knowledge, skills, and attitude to enable you to be a functional pre-registration pharmacist. You will be capable of facing the challenges of the evolving healthcare landscape and the complexity of people whom you will be serving.
We hope to innovate new roles and improve pharmaceutical practice within the healthcare system through research, the use of technology, enhancing the power of big data sets. These new skills required have been incorporated into a relevant and interactive curriculum where our students will take an active role in their learning journey and be ready as healthcare professionals of the future.
As a leader in pharmacy education in Asia, and as the only pharmacy program in Singapore, we are continuously reinventing ourselves to ensure that our graduates remain competitive and are equipped with the relevant knowledge and skills essential for their future careers.
Our Bachelor of Pharmacy Honours Degree Programme offers these unique features. First, we have a transdisciplinary curriculum. Second, we use modern pedagogy, of which team-based and blended learning focused on problem-solving is central. Third, we are focused on experiential-centered learning. Let me elaborate on our unique features. Our pharmacy curriculum is based on the transdisciplinary design model, equipping our students with both academic skills in various disciplines and non-academic soft skills such as critical thinking, communication skills, compassion, professionalism, and so on, to prepare them as a 21st century pharmacist to be competent in managing medication and health in the real world. In terms of the academic skills in the various disciplines, our curriculum integrates the different disciplines across the basic sciences, including medicinal chemistry, pharmaceutics, biochemistry, pharmacology, and so on, as well as the clinical sciences, including therapeutics, clinical pharmacokinetics, toxicology, and so on, as well as the system sciences, including public health, pharmacoeconomics, and so on. To scaffold and integrate learning, our curriculum builds on the foundations in science and professional identity, which are introduced in year 1, after which the bulk of the curriculum will be delivered in the form of a system-based approach with 9 physiological system modules with integration of disciplines. In the final year, we break down the silos for students to apply what they have learned in managing complex patient populations. So how does a physiological system module look like? Let me use the cardiovascular system module as an example. In a system-based approach, thinking and learning are no longer divided according to subjects, but according to systems. That is, if students learn about the cardiovascular system, they will be learning every aspect of that system, drawing knowledge across different disciplines and seeing how they are all connected together for a specific need. That is, the prevention and management of cardiovascular diseases. Students will learn about the anatomy of the cardiovascular system, what can go wrong in disease states, what are potential targets and drugs to manage the diseases, how do we devise a care plan for a patient with cardiovascular disease, and how do we prevent the onset of cardiovascular diseases in the general population at large. So how are our modules delivered to our students? One of our means is to use the flipped classroom approach. This learning model first transmits the head knowledge to the students, which they can pick up at their own pace, and then we transform the classroom into deeper engagements in small group discussion. In doing so, we increase the value of the face-to-face time the students have with the lecturers, and also to create a less intimidating small group setting so that they can ask questions and clarify their doubts. In the collaborative learning workshops, we adopt the team-based learning or TBL pedagogy. This promotes active and collaborative learning, which improves knowledge retention and also builds soft skills, including teamwork and communication skills, which are important to prepare our future pharmacists to work collaboratively as a member of the healthcare team alongside doctors, nurses, and other allied health professionals. In addition, we believe that retention and application of head knowledge is much better with hands-on experimentation. About 60% of our modules has some form of laboratory work attached to it. From such activity, not only do students gain further understanding into the theories taught in class, they are also equipped with skills to support their capstone discovery projects, and some students become inspired to go into research. One aspect that makes our pharmacy program different from our pharmaceutical science program is the emphasis on developing pharmacy practice skills. Students are put through simulated exercises that train them on actual skills in compounding, dispensing of medication, counseling, and familiarization with actual work environment within retail or hospital pharmacy. Another aspect to highlight about our pharmacy curriculum is the experiential learning and capstone project. There are 2 parts to this. First, we have an experiential learning in the form of a 1-day-a-week experience in the community pharmacy that is run longitudinally from year 1 to year 3. This helps to develop the professional identity of our students as budding pharmacists. In addition, at the end of year 3 and throughout the first half of year 4, students will spend full time on pharmacy internship for 24 weeks continuously in the form of 2 rotations of 12 weeks each. This counts towards their pre-registration training for licensure. Second, all students will also undertake a capstone discovery project. This is a problem-based learning whereby students will integrate all the knowledge they have accumulated to solve a real-world problem in stepwise and finally communicating the solution they have gathered in writing as well as oral presentation. Through the way in which we deliver our integrated pharmacy curriculum, at the end of the 4 years, our pharmacy graduate will be a care provider, an expert in ensuring the best use of medicines. In order for our graduates to do that effectively, we develop our students as excellent communicator, good collaborator to work in healthcare teams, a scholar innovator through the Capstone Discovery Project, a leader manager, a health advocate to promote public health and prevent diseases, and last but not least, a healthcare professional who is guided by a strong set of values and ethics suitable to be registered as a pharmacist by the Singapore Pharmacy Council and suitable to be entrusted to look after the health of our population. For students whose aspiration is to be a pharmaceutical scientist rather than a healthcare professional, our Bachelor of Science in Pharmaceutical Science Honours Degree Program offers a specialized science degree that prepares graduates with a wide range of expertise to meet the demands in the pharmaceutical industry. Our pharmaceutical science program does not lead to a pharmacist license. Instead, it is focused on training pharmaceutical scientists as qualified experts in aspects of the science and technology of medical products. This includes, but is not limited to, the discovery, development, manufacture, regulation, and utilization of medical products, embracing how medicines work, how safe and effective products are brought to the market, their impact on the body, and their effect on the treatment and prevention of disease. Let me now introduce you to our pharmaceutical science program via a video clip.
The Department of Pharmacy has an outstanding history of delivering high-quality education and research. Not only will students learn from our experienced academics, they will also interact with industry leaders throughout the course. This is one of our strengths, having well-established links with the industry and alumni. Such interactions allow students to gain valuable insights on real-world issues and gain a better understanding of their career paths. Plus, they are not limited to a local experience, as they have a wide range of overseas exchange programs to choose from to broaden their intellectual and social horizons.
The Bachelor of Science in Pharmacy program is the gateway towards registration as a pharmacist in Singapore. On the other hand, the Bachelor of Science Pharmaceutical Science program focuses on the foundational and the scientific principles behind the use of medication. It comprises a range of scientific subjects that deal with the various aspects of pharmaceutical substances and is tailored specifically to groom graduates for career in the pharmaceutical industry.
This is a 4-year direct honours course, and it will introduce students to foundations in pharmaceutical sciences. Graduates from this new program will be equipped with a broad skill set and be able to embark in a dynamic range of careers. Graduates will have excellent prospects in areas as diverse as research and development, manufacturing, sales and marketing, regulatory affairs, quality management, and clinical trial management. Depending on each graduate's interests, you may also find employment in areas outside the pharmaceutical industry, such as biotechnology, consumer healthcare, patenting and licensing, medical writing, or even become the next generation of healthcare entrepreneurs.
Singapore is a leading biomedical science hub in the region. Many global pharmaceutical companies have established R&D, commercial and manufacturing operations in Singapore. We're looking for individuals with a solid technical depth that can operate both across the technical and commercial environment. These individuals need to be versatile and adaptive to the changing commercial and regulatory environment we operate in.
The pharmaceutical industry is exciting because we are focused in innovation and science. We want to have exceptional clinical outcomes to transformational science and transformational medicine. Therefore, it is a very interesting and it's a very purposeful industry, and it's an industry that is constantly looking for talents to join us. I think this program is great because it is a reflection of what the industry or what the healthcare needs. And it's also about what Singapore needs.
Well, the industry is experiencing a technology revolution, and there is a fundamental shift in the way new drugs are discovered and developed. It is important that we embrace these changes to move new and innovative therapies for better well-being. There are elements in this new program that will prepare students for these exciting changes. The curriculum is flexible, is broad-based, and grounded in the sciences. The solid foundation in the sciences will support our exploration in the pharmaceutical science. At the same time, students get to plan their own learning and pursue other academic interests, such as business, forensic science, or analytical chemistry, just to name a few. And this versatility and adaptability is much prized and prepares them for a variety of career opportunities even beyond the pharmaceutical industry.
So the mission of the Pharmaceutical Science Program is undergirded by a firm foundation in bioorganic and medicinal chemistry. This addresses the discovery phase of the industry. The depth of knowledge and the intricacies of the industry will be covered by the pharmaceutical science niche that's unique in the program. This is delivered by our team of professors and industry lecturers. Our industry lecturers make sure we stay relevant and ahead of the curve. Also, we value the versatility that comes with the program by equipping graduates with life skills, experiential learning opportunity that maximizes employability in diverse careers beyond the pharmaceutical industry. Our pharmaceutical science students will experience these unique features offered by the program. First, we have small class size. Second, because of the small size, we are able to use modern pedagogy of which team-based and blended learning focused on problem solving and not rote learning is central. Third, we are focused on internship-centered learning. Let me elaborate on our unique features. Each pharmaceutical science cohort has about 50 students. The small class size allows everyone to be familiar with each other. Students will be working mostly in teams and not alone to prepare them for the same type of collaborative culture that is central to the pharmaceutical industry. Team-based learning is a strong feature whereby students will stay with their team for a year and learn to fulfill tasks in a team. The small class size also allows deeper dialogue between instructors and students. After 1 year, we pretty much know every student by name and profile and can facilitate their learning more directly and longitudinally. Our instructors will use flipped classroom and blended learning approach, not by teaching subjects such as biology, chemistry in isolation, but we design problems to drive active learning and inquiry-based learning and inculcate the discipline of self-directed learning. We also emphasize on integrative learning, whereby modular contents are reorganized to help students see the hypothetical problems that they work towards solving. Let me share more on this in the next slide. We believe firmly in integrated knowledge, as in higher education problems become more complex and we need to be comfortable with problem solving with different tools and information. So how will integrated knowledge look like? The suite of modules for the pharmaceutical science program will not be topics or subjects in silos, but rather systematically weaved so that students have a framework to approach real-life problems. For instance, students will be introduced to 3 modules that will have what we call the ABC elements of analysis, biology, and chemistry. These 3 foundational modules will then prepare students for deep pharmaceutical science knowledge in the next levels. The first module focuses on the central theme of drug receptor-drug target interactions. We will integrate chemistry and biology knowledge to help students understand the chemistry of the molecules of life and how drugs can effect an action by working on the molecules of life. In the second module, we will integrate analysis and chemistry and focus on the physical-chemical properties of drugs. We will teach students how to synthesize drugs using different chemical reactions and how to identify and analyze them, not just for chemistry's sake, but also in compliance to standards required for the pharma industry. Finally, in the third module, we will look at the macromolecules, understanding their synthesis, identification, and characterization for the biopharma industry. With these 3 foundational modules, students will be prepared for inquiry-based learning through experimentation in the lab. We have 2 lab-based modules, which students will apply and integrate what they learned with laboratory practice to solve problems in the continuum of drug discovery and development. To make learning real, students will be guided to include experiential internship learning as electives and are typically 3 to 6 months in duration. This exposure will give students a head start in networking with key personnel in the industry and see how real-world problems are solved with the knowledge and skills they have. Even though our pharmaceutical science program is very young, we started in 2018, but to date, almost all of the students in our pioneer cohort have experienced internships in places spanning from big pharmas, startups, SMEs, upcoming digital health setups, and research institutes. Our students' internship placements have been successful in part due to our close connections with the industry and proven track record of high-quality students. You might also be interested to know the range of job functions that our pharmaceutical science students have undertaken in the companies during their internships, which enrich their education to prepare them for their career aspirations. So in closing, I hope this presentation gives you a better overview of the distinct characteristics of our undergraduate pharmacy and pharmaceutical science programs. With the 2 programs, it is the aspiration of our department to nurture future-ready pharmacists and pharmaceutical scientists who will make positive contributions to improving healthcare. And with that, I would like to thank you for your kind attention.
Thank you very much, Dr. Yeo. It's very outstanding sharing and also very effective presentation. So for the audience, if you have any question at any time, please write it down in Q&A pods, and we will discuss it in the discussion session after all the speakers in the session 1 present their talk. So we continue to our third presenter for this session. I would like to invite Professor Dr. Gerhard Furtwängler from the Hannover University of Applied Sciences and Arts, Germany. Guten Morgen, Professor Gerhard.
Guten Morgen.
Wie geht es Ihnen?
Mir geht es ganz wunderbar.
Okay, good then. Okay, how is it in Germany? Is it everything better now with the pandemic, or how is it?
Yeah, the pandemic is quite under control now. Yeah.
Okay.
So we have very low incidence numbers, but you never know. So everybody is talking about the Delta variant, and everybody is somehow scared because we went through a very hard time at the beginning of the year with high numbers of incidences, but now everything seems to be better, but let's see how it goes further now.
Okay, thank you. Good to hear that. Okay, Professor Gerhard, he's a professor in clinical research and epidemiology at the Hannover University of Applied Science and Arts, and he's also already being a visiting professor in the Faculty of Pharmacy, Universitas Gadjah Mada. Thank you for accepting our invitation again, Professor Gerhard. So the time is yours for the next 30 minutes. Thank you.
Yeah, thank you very much. Give me a second to get everything prepared. Let me look here. Do you see the slides properly? No, right?
No.
No.
I think you clicked the right.
The task line always looks different, so it is always.
I found that you click that 3 dot on the under the slide, and
that's the
and then remove on the lights. I got trouble.
That's not this one. Oh my God.
Yeah.
I think
need
that's one.
Help. I need some help.
Yeah.
I need some help, my dears.
Yeah. Click there. Click.
Where?
Yeah, I think that's the right.
On that 3 dot under your slide. Yeah. Click. Yeah. And then delete. Oh, there's German.
Bildschirm? No.
On some of them, 2 of them.
I think that's one.
Above. Okay.
Is it this now?
Yeah.
We can see it.
I start.
Congratulations.
Made it. Okay. Good morning. Good morning from Germany, and selamat siang to you in Indonesia.
Selamat siang.
Thank you very much for the introductory words, and especially for inviting me to speak here today. So it's my pleasure. I'm very happy to do that. Public health and the connection to pharmacy does not always seem to be immediately recognizable, and whereby pharmacy, especially the field of community pharmacy, is a prime example of the implementation and control of healthcare measures in a society. Curriculum development, from my perspective, is also a very exciting field of work. And reporting on news in program content, however, is not that easy for me. In Germany alone, we have more than 15 public health programs, and each with a different content, with a slightly different content. So some are primarily practice-orientated and others are more competency-orientated. We need to consider the following points in the development of a new or the revision of an existing curriculum. First, are there state requirements, mission statement of the university, and what about the external image the university wants to give or the faculty wants to provide? And also, what are the goals of the university, of the faculty, or the special department, for example? And what fields of activity does the program prepare the students for? This is also very much important. So you said at the beginning that I'm from a University of Applied Science. Our objective is always to train people in a way that they can do their jobs later on in their professional career properly. And for this, we need to talk about the skills, abilities, knowledge that students should require and acquire during their training at our universities. And what is the contribution to the personal development of students? So we have to think about this when we do modernize our curriculum. And also, what type of innovations and special features does the program offer? And any university is always looking for a kind of selling point. And it is also important to think about how does the program fit with the university or other programs of study that are offered by the universities? And last but not least, are there any legal requirements that we have to comply with? And as soon as we have answered all those questions, we need to start the analysis of possible employment situations, and because those concern the requirements and fields of activity for which the students are to be trained. And based on this analysis, we have also to further analyze the required and the desired competencies, which means skills, abilities, and knowledge that students need to cope with during their professional situations. And the topic is here, challenges and future trends. And what we have learned during the pandemic, because we did totally switch from classroom sessions to digital teaching, the challenges or the changing challenges in the world of work require differently new competencies that can already be taught with structured and agile university teaching, the so-called curriculum 4.0, as it is called in Europe, and also in Germany, where a group of the Higher Education Forum in Germany did address that. And they said, okay, at the core of these theses and recommendations on curriculum development and competencies is digitalization. And we need to have a process that involves all stakeholders and translates the dynamics of the digital transformation into responsive curriculum development. I'm sure that these requirements have also found their way into the curriculum at your universities, the universities of the attendees of this conference today, more or less, depending on resources, and not only personal resources, but also infrastructural resources. Community pharmacists, as I said, they are recognized and supported within national health systems as key health professionals, making a dynamic, sustainable, and evolving contribution to the health of individuals and communities they serve while strengthening the health system. In Europe, there is one working group. It's called the Pharmaceutical Group of the European Union, PGEU. And this group is the voice of community pharmacies in Brussels. Brussels is the capital city, not really a capital city, but in brackets, capital of the European Union, where the European Commission is located. And Brussels is the capital of Belgium. And this group, the main objective of this group is to advance the contribution of community pharmacists to European health systems. And not only to the system, also to the individual societies of the countries concerned and the individual patients. This association and working group is responsible for creating the conditions for a successful implementation of the public health strategy for pharmacists. In detail, they advocate and advance and protect the sustainable contribution community pharmacists to community pharmacists to make to support also individual health, public health, and the health system through the promotion of the responsible use of medicine and the provision of professional and clinical services. And they also promote and develop cooperation in community pharmacy among the European countries. You know, the European Union currently consists of 27 different countries. And this group is also making them somehow working together. And the group also ensures our vision of community pharmacy, and that the vision is properly reflected in European Union policies and legislative development strategies. And this area is only one part of public health, I know that. But from my point of view, it is an important area that also establishes a direct link to pharmaceutical education. And because we have here now a pharmaceutical conference, I thought it might be good to talk a little bit about this link as well. Because considering the conference title, it is therefore important to me to look at this dimension from the perspective of pharmacists and from the perspective of the pharmacy curriculum, which means to clarify how elements in pharmaceutical education ultimately represent also public health components and which ones are perhaps still missing in some curricula and should be supplemented. So I can't provide individual modules to be implemented, as those heavily depend on the existing curriculum at the different locations at different universities. Before we change or add content to a curriculum, it is important to create clarity about where we want to go and what we want to achieve through the change. And you may have heard about the WHA One Health initiative. And One Health is an approach to designing and implementing programs, policies, legislation, and research in which multiple sectors communicate and work together to achieve a better public health outcome. The One Health approach is critical to addressing health threats in the animal, human, and environmental interface. And these areas of work in which One Health approach is particularly relevant include not only, but also food safety, control of zoonotic diseases, lab services, neglected tropical diseases, environmental health, and also antimicrobial resistance. And the second part, what I said, the second bullet point, control of zoonotic diseases. So this is something that we are currently faced on everywhere in the world. All these areas cover complex issues that require close collaboration across sectors, stakeholders, and countries. The WHO works closely with the Food and Agriculture Organization of the United Nations, the FAO, and the World Organization for Animal Health, OIE. And the work is to promote multi-sectoral responses to public health threats originating in the animal, human, or also environment interface, and to provide technical advice on how to reduce this risk. This initiative provides a significant foundation for further development of existing curricula from my perspective. And the key point of further development here is to focus on interdisciplinary elements. And the objectives are, for example, doctors, dentists, pharmacists, veterinarians, public health experts, and so on. Everyone who belongs somehow to the health sector should work together, and not only within the curricula, also later in practice. The European organizations representing medical doctors, dentists, pharmacists, and also veterinarians, and their student organizations, they held a meeting in 2019 in Warsaw in Poland. And I want to discuss with you the main or the key outcome points out of this meeting. And maybe this is something that we should consider whenever we talk about challenging elements in curricula or curriculum development. The professional and student organizations, they represented here at this meeting, or how should I say, event, they called on national agencies and policymakers, academics, professionals, and also students to update standard curricula to include and promote interdisciplinary education at universities. They did talk about training educators to promote interaction among students from diverse backgrounds, and also to launch and support collaborative initiatives to further implement the One Health approach. The highlights, if we want to give them a kind of bullet list, the highlights are students should be given more opportunities to learn together and collaborate closer in practice. And when I talk about students, then I mean students from different subjects. They are an active part of academia and must be considered as one of the main forces within universities for driving changes today. And it's our role as professors, it's our role as academics to make sure that our students get the right training material at hand, that they can really play that role afterwards. Moreover, the engagement of students with society can have an important impact. One Health is a concept. It means it's an idea, a principle to be integrated. In the teaching of all the subjects, clinical and non-clinical, in medical, dental, pharmaceutical, and also veterinary curricula or public health curricula. And One Health requires the sharing of knowledge and experiences through interprofessional collaborations. Therefore, One Health education is about learning together, not about adding a new subject. It's nothing new. We should not add something to the existing curriculum. What we should do, we should change the curriculum so that more than only one subject or one student group can benefit from it. Currently, the education of health professionals is organized in isolation most of the time. And however, the undisputed value of the One Health approach to tackle different challenges related to public, human, and animal health leads to the need to establish an interdisciplinary education. Experience gained from these models of education should be further investigated and they should be promoted. And there is a need for developing guidances also on a common understanding and implementation of One Health. And this was one of the outcomes also of this event, that they said, okay, currently we don't have the material. We cannot really promote it because we don't have a common understanding what is meant with it. And then last but not least, they also said, okay, educators should be encouraged and should be trained to consider a different model of teaching that facilitates interdisciplinary interaction and education. So a lot of demands, a lot of requirements that came out of the meeting, but maybe, as always in life, you cannot start with all at the beginning or from scratch, but at least this is something that could be taken as a kind of signal that we say, okay, let's start with this, let's start with that. And I will come up with a little proposal at the end of my presentation. It doesn't take that long anymore, no worries. I will talk about that, how we can start and how we can get the ball rolling. Perhaps the example of the One Health initiative have convinced you and you would like to implement this effort curricularly at your universities. As always, there are several ways to change programs, and I would like to suggest one way. From my perspective, the way how people can cope with this kind of initiative. This way should not be too drastic from my perspective. So you should not say, okay, so far we had a pharmaceutical curriculum, we had a medical curriculum, and they have been isolated. And from tomorrow on, we will have one curriculum that fits for both purposes. I would like to suggest a way that at least provide enough evidence whether the chosen method of change is so locally accepted. As I said already, the current model of academic specialization encourages development of isolated disciplines within the university setting. And I don't believe that it's too much different also in Indonesia or any other neighbor country of Indonesia. So at least in Europe, we do have that, quite isolated disciplines. And those isolation creates barriers to resource sharing and also academic collaboration. Maybe it is a little different at your university and you have started already implementing some areas that are taught interdisciplinary. Please take out what I will be telling you now, just take out the best that might also be somehow helpful for you. The way I want to present compromise the following steps. The first one is you should identify a current problem that would benefit from an integrated interdisciplinary perspective. Nowadays or today, there is something going on around the globe that does affect all of us. It's the pandemic. So maybe this is a good starting point. The pandemic might be a good starting point to talk about this disease and all the surroundings around it, and to talk about it in an interdisciplinary way, not only to pharmacists, not only to medical students, not only to dental students and to public health experts, so bring them together and discuss the pandemic situation, for example. After that, identify individual disciplinary teaching areas pertinent to the problem. It could be health communication or wildlife ecology or whatever, yeah? Then you continue with identification of competencies expected to be attained by graduates who will address this problem. Yeah, for example, what is really required, what is needed for a proper response to outbreaks, for example. Yeah, and this is not only the job of a public health expert, it's not only the job of the pharmacist, it's definitely not only a job of the medical doctors. So it does concern all the health professions. And then if you have identified one area that you could work on for implementation of an interdisciplinary approach in your curriculum development, then you might also survey faculty members on their teaching areas and curricula offerings that address these competencies. And then compile responses, if you want, in a database or whatever tool you might have at your hand that is searchable by teaching areas and competencies, so that people also have access to this new methods, through this new functionalities, through these new ideas, and that they can include that in their own seminars or lectures. What could be more fitting today, as I said already, than to use the current pandemic as an opportunity to incorporate One Health into the curriculum? If we don't want to start with the curriculum, because a curriculum is a huge document that needs approval by different stakeholders, by different parties. So, and this is definitely something that you cannot simply change several times a year. Nobody will do that because it's really a hard work to do that. So, but what if you don't want to do that? You can also start with a summer school or with one singular course. Preparedness in response to zoonotic disease outbreaks requires coordination and collaboration between countries, sectors, and stakeholders working in the animal, human, and also environmental interface. We all have learned that during the last 1 year and a half. And we also know, or you might know, that we do have many projects outside the university training scheme, and the WHO supports member states to strengthen their capabilities for preparedness and response to outbreaks of zoonotic disease through improved coordination that applies the One Health approach. So if you want to learn something on country level, WHO is at your side and helps you. This includes preparedness training to improve the understanding of the perspective of the other sectors when facing a zoonotic event. A similar approach could be implemented in summer schools, for example, in which students from different disciplines participate and contribute to the content. I'm a big advocate of such a strategy and offer courses on a smaller scale. Most of the time, those are elective courses that can then be taken by international students. Last Friday, just last week, I just finished a course with a total of 115 students from Germany, Indonesia, different countries in Africa, and also India. And the topic was monitoring of clinical studies and protocol development for clinical research projects. And the course was held digitally. Okay, this is a big advantage because you can keep people from different locations together. And it was once a week from March to June with 2 to 4 semester hours. And the contribution and the discussions in the group clearly showed me there is a need for an interdisciplinary approach and encourage to try further models in this regard. Let me just give you a quick summary and put together something for you to take home so that you don't forget, to make it more easy. One Health addresses many health-related disciplines and should be the basis for modernizing existing curricula. My perspective. One Health does not mean adding another field of study. It is a concept, and we all know what a concept means in academics. And the concept is based on, or this concept is based on interdisciplinarity. Pharmacy is a core science in healthcare and consequently in the broad area of public health and offers overlap with other areas in science that should be used synergistically. And if we could do that, then we will also benefit from it from an academic side. And stepwise approach represents an option to explore new avenues without compromising already established educational strategies. Thank you very much for listening to me. And in case you should have any question or suggestion, I am happy to answer as long as I can. Okay. Back to you, Professor Triana.
Thank you very much, Professor Gerhard. Such a nice and awesome talk you have already added to what our previous presenters has already brought up. And you bring out about the idea about One Health. I have good news in UGM also have one program, a summer course in One Health. It's about Komodo and wildlife. It's quite interesting, isn't it?
It is, yeah.
I think it will be interesting.
I just did mention the wildlife ecology because this is something totally different, but just to make it clear that there is a broad spectrum of options that we can take from. Yeah.
Okay, thank you, Professor Gerhard.
You're welcome. You're welcome. My pleasure.
Okay, everyone, so we come to last but not least, the fourth presenter of this session. I would like to invite Professor Ian Bates from University of College London. Good morning, Professor Bates.
Good morning to you, and thank you for the invitation.
Okay, thank you for accepting our invitation. It's such a great honor. Ladies and gentlemen, Professor Ian Bates is hold the chairs of pharmacy education at the UCL School of Pharmacy as head of educational development, and is also a faculty fellow of the Royal Pharmaceutical Society. And Professor Bates is also the Director of Education Development for the International Pharmaceutical Federation, of FIP. And I think there are also so many achievement that is already that's already written here, and I think everyone is looking forward to hear share from Professor Bates. So the time and the screen is yours, Professor Bates. Please.
Thank you so much. Display the slides. Hello.
Hello. Can I help you in any way?
Yeah. Okay. I'm trying to share my screen. Just 1 second. We're nearly there.
Okay.
My apologies. I've just had a little bit of an IT breakdown. I'll be with you in just 1 second. Give everybody a chance to have a sip of their coffee while this is happening.
Okay, that's a good idea.
It's always the same. You think everything is prepared, but all of a sudden that internet lets you down at the very last moment. So here we go. Let's see if this is now working. Oops, we don't want that. Sign in. Here we go. Well, I pressed all the right buttons.
I think so, yeah.
There we go. How's that?
Yeah.
Are we good there?
We can see it clearly. Thank you.
Okay. All right. Thank you very much for inviting me. Sorry for that small hiccup. So your future pharmacy curriculum theme is a very interesting one and very relevant right now. Gerhard's very interested in Gerhard's presentation just now about that overview of public health, and certainly the ambitions to now and sort of really focus on pharmacy and pharmaceutical care, and have a closer look, I think, at why pharmacy has some challenges ahead. And I'd like to expand the notion of curriculum. Most authorities, I'm no expert in curriculum studies, but most authorities would argue that curriculum is much more than content. It's much more than the topic. It needs to encompass a broader consideration of public vision, if you like, and to incorporate all of those constituencies who are affected by curriculum, not just the students and the academics, but in our case, of course, patients and healthcare provision. My argument this morning is that for the future pharmacy education curriculum, we need to look outside of the university, and we need a broader and more direct engagement with continued education, continued development, in effect, a broader engagement with pharmacy careers. And I personally believe that the university as an institution, the university as a concept of higher education, should not ignore career development any further. I think the university should be a much more active participant in continued career-long activities for pharmacists. So I'd like to look at this notion of professional curriculum today, all the way through from initial education and training to early careers and beyond. In effect, sort of looking at what a strategic view of the professional curriculum for workforce development might need to be shaped in order to meet our national healthcare needs. Okay, so I've got 3 sections to this talk, and the first one is about making sure we don't get left behind in the university with the rapidly changing healthcare and pharmaceutical science sector. This is a diagram I use quite a lot. It shows all those drivers that affect our pharmacy workforce, all the way from national policies, which your government is producing, and my government is producing. All governments are very busy producing new policy drivers for healthcare at the moment. Our financial and economic constraints that we have in nations, demographic changes, knowledge and technology expansion, and of course, new ways in which pharmacists and the pharmaceutical workforce should be delivering healthcare services. These are all predominantly educational issues. It is kind of what our workforce looks like. Everyone starts off at university as a student. Often that's integrated or is followed by a pre-registration or an internship period before we have this big block in the middle called the registered workforce. These are the people doing the jobs and hopefully properly trained to do those jobs. We lose people from that workforce. Of course, a lot of people take career breaks. They go off and start families, for example. They leave the workforce, in other words, for a varying amount of time. Many people are increasingly not participating in the pharmacy workforce. They're participating in another workforce. Pharmacy may just be a vehicle for alternative careers. People retire, and people die as well. So we lose people. We have an attrition from the workforce, and our national workforce plans have got to balance up this entry, the supply side of the workforce, with this attrition to the workforce. My question, perhaps, which doesn't need an answer today, but it's important for the universities, is how many pharmacists do you need in Indonesia? Do you need more? Do you need fewer? Do you have unemployment in pharmacists? Do you need to expand sectors of the workforce? There's surprisingly little debate about how we plan our pharmaceutical workforce, unlike medicine or nursing, for instance, where there are very often very well formulated plans. But the skill set, the capabilities are an integral part of this workforce shape in any national workforce. And most of these things, and I've circled them here, are actually about educational development. Workforce planning and the shape of your national pharmaceutical workforce is actually an educational issue in many ways. This sort of rather crude diagram here shows the dimensions of these workforce. Again, I've circled those elements which are about education and educational development, career development. What's the scope of competencies we need? The supply, the recruitment, the actual size of the workforce is important, as we'll come to see. And the capabilities are all key indicators. When I look around the world, and I'm here today talking as a representative of the International Pharmaceutical Federation, which represents about 140 countries around the world and about 4 million or so, maybe it's probably more like 5 million now, pharmacists around the world. We see very similar challenges and issues in many countries. And often these are about the transition. So moving from an intern to a licensed or a registered pharmacist, that's a very difficult transition for our young pharmacists. Moving from being a student to being an employee is a very difficult transition for many. These transitions are often compounded by clinical training and the experiential components. I don't know how much experiential learning you have generally in your pharmacy curricula in Indonesia. I know it's variable around the world, but we do need to focus more on that. Wherever your university is situated, we absolutely need more clinical and experiential training incorporated into curricula now. There are new models of continuing professional development emerging around the world, different ways of doing CPD, different ways of regulating CPD. In other words, how staying on the register and being a continued registered pharmacist, how you develop your continuing competencies has some variance depending on what country you're in. Advancement and expert practice, how much is the university engaged with developing specialisms? And I'll talk in a short while about reshaping general practice as a specialism, because it's an urgent requirement now, and how we recognize specialization. So I do believe that universities are not engaging as much as they should in that curriculum development for advancement and specialization. Let's see if this works.
And I'm a pre-registered pharmacist, and at the moment I feel like I'm a little bit lost with regards to my career pathway. I don't really know where I'm going and what's the right way for me to format my life in terms of as a pharmacist in the future. So I feel like I would really benefit from someone helping me and showing me the way and the path to move forward and progress and develop my skills and competence as a pharmacist.
So that was a young pharmacist who's just been registered. So she's done her university training, she's done her internship, and here she is in her early career saying, I really don't know what I'm doing. I need some support, I need some structure, I need some continued training, in other words. And this is a very, very common feature throughout the world. Certainly with my medical colleagues, so-called foundation training or early career training is a very prominent feature of medical education. It's something we don't focus on very much in pharmacy, and that, to my mind, is a problem. Certainly the structures I have built and developed in my half of the world over here in the UK is a continued seamless progression from graduation and licensing into early career structures. So we have a curriculum for that. We have a continuing curriculum which reaches out into early career years to consolidate those experiences into structural training for young practitioners. And I firmly believe this is a big issue for us worldwide, and an issue which I'm trying to actively promote. Because moving from being a student into being an employee, a registered pharmacist, is a very tricky transition. As a student, you have everything. You have lots of support, lots of guidelines. You have lots of academics, like Professor Triana, for example, helping students through their early education training. But what happens when people move into a typical workforce environment? Well, things change. A lack of curriculum there, a lack of support, recognition of learning opportunities. How do we support people as they move into these early career years? It's a significant problem. Our profession will not develop rapidly or not change for our healthcare needs unless we do start to focus on these early curriculum years. And let me show you why. Here's a very typical patient. I walked into one of my local hospitals very recently, and I asked one of the pharmacists, just grab hold of some patient notes for me, please. I don't care who it is, anyone will do, anyone on this particular ward. And this particular patient, randomly chosen, was taking all of those drugs. And that patient had all of those comorbidities. They weren't in hospital because of all of those comorbidities. This elderly lady was only in hospital because she had a urinary tract infection. But she had all of those ongoing pathologies as well, and a long list of medicines. But of course, that patient is not staying forever in hospital. She's going to go back home. It's either going to go back to her own home or to a care home, a nursing home. So she's going to be back in a primary care environment very soon, still taking all of those medicines, still with all of those comorbidities. Who's looking after her medicines? The primary care doctors are struggling. They need help because of all of this comorbidity in primary care environments. Our early career pharmacists need to tackle these experiential issues quite urgently in order to maintain a very high level of clinical input into maintaining health in these complex patients. All of our populations in Indonesia and in the UK and everywhere in between, we are all growing older as populations, but we're all growing older with more disease, more comorbidities, and we're all taking more medicines. This lady here is not atypical. She's absolutely a typical patient, absolutely taking an average amount of medicines. And it's a problem we need to face up to if pharmacy is to continue to be a significant provider of primary healthcare. My focus is on competency-based education and training. It's translating all of the theory, translating all of the initial education and training into a competency-based progression for careers. And this metaphor about the competency iceberg is very true. What patients see, what governments see, is the tip of the iceberg. They want to see effective and persistent behaviors in our pharmacists. That's what they see at the very tip. A good pharmacist able to deal with all of this complexity. What goes on underneath the waterline is a huge amount of knowledge, an application of knowledge, capabilities, skills, abilities, values, which goes on into supporting that persistently effective behavior. And this is the basis of competency-based education and training. And our university sectors, we really do need to engage with this rather urgently, I think. We need to push ourselves up from the knowing stuff, the knowing how, all the way up into making sure that we are doing at initial stages and in continuing engagement, looking at performance-based assessments and in vivo assessments. If you want a couple of good papers, and one of your Indonesian colleagues was an author in these two papers, looking at the trends over the last 15 years in workforce development, competency-based education and training, which has seen a huge explosion, not certainly in medicine. Most of medicine now is a competency-based approaches, and our theory, our message here is that in pharmacy too, we need to start developing competency-based curricula moving forwards. Let's move on then, because my argument here is that CBET, competency-based education and training, should start with the university. But the curriculum is more than that. The curriculum needs to take in societal changes as well. Here is some stuff from WHO. There is no health without a workforce. We need to continuously be focusing on our pharmaceutical workforce, and the universities are included in that focus as well. The WHO strategy leading up to 2030 predicts shortages of pharmacists and doctors and nurses and midwives to meet the increasing expectation and demands of our healthcare systems throughout the world, which means investment. And that investment means should really be focused on lower middle income countries as well. They're going to suffer the brunt of these shortages, and pharmacy is no exception to that. Here's, I think, a fairly modern data set for the global pharmacist workforce. This is standardized to population size. You can see Indonesia is in the middle of that huge variation in a standardized national pharmacist workforce there. So there are many countries to the right who have maybe fewer than who they need. And there seems to be many countries to the left who have large numbers of pharmacists per head of population. Which way is Indonesia going? Because this is a changing scenario in actual fact. And I'll show you some figures we've recently got for Indonesia in just a second. When we project forward, and this is FIP data that we've published here, we do see growth in the pharmaceutical workforce. In other words, more pharmacists per head, and that must mean more students in universities as well, because that's the supply pipeline. So universities are producing more students, and we have more registered pharmacists in the workforce. And you can see the growth curves there for different regions. What is worrying is the economic gap, which seems to be emerging. So with low-income countries, that growth rate in the pharmacy workforce is much, much less than it is in higher income countries. And that is a significant worry, I think. This is the Indonesia pharmacy workforce. You may know that I'm working quite closely with the IAI right now through FIP, looking at the current Indonesia pharmacy workforce. You can see on the bar plots on the left, 1994, bar plots on the right, 2019. And there are two immediate issues for you here. One is the growth in younger pharmacists over this period of time. Look at that population pyramid of the pharmacy workforce in 2019, heavily weighted towards younger pharmacists, and they are hungry for change. They want better career support, a professional curriculum to help with their development, and you can see that there has been a massive growth in young pharmacists. You can also see a huge change in the proportion of female pharmacists participating in the Indonesian workforce. Many more females than males, and that has been a growth curve over the last couple of decades. And that's important because females in our healthcare workforce, whether they're female doctors, female pharmacists, female nurses, will want to take career breaks, maternity breaks, to have children, as we all do, and they will need to come back into the active workforce after that, because we can't afford not to lose these valuable, highly trained members of the workforce. So bringing people back into the workforce is critically important. Otherwise, we will have severe economic issues with our workforce attrition. So we all need to be transformative, and our health system drivers are driving education and training, and the university should be taking note of that. So my main thesis here is that the curriculum, the professional curriculum, needs to have a wider term of reference as well. My third section is about that transformation as careers, so a curriculum as part of the career journey. So workforce development, building on foundations of practice, but also building on advancement as well. Where is the university connected with the majority of the workforce, which is at some form of advancement stage? Well, that box in the lower left-hand corner there is the one that the university tends to be fixated upon, producing pharmacists who graduate, who get registered, so-called day one pharmacist. That's the point where we normally wave goodbye to people from the university. We've done their initial education and training, they've done their internships, we wave goodbye and we say, have a happy life and have a good career. And our engagement often finishes at that point. My argument for us today is that we need to continue that engagement, working with other agencies in order to develop advanced practitioners who are more able to do more complex things with medicines and clinical pharmacy and pharmaceutical care with our populations, which, as we have seen, are becoming more complex every year. This is a slide I borrowed from WHO. It was the European director of WHO at an AFIP conference, who was talking about advanced services in community settings, community pharmacy settings. And I was absolutely astonished to see WHO was putting so much emphasis on using community-based pharmacists for advanced services in communities. Medicines reviews, monitoring diabetes, monitoring long-term illnesses, diagnostic services, and as we've all seen very recently, a key player in emergency situations and emergency pandemics. Pharmacy has saved many, many lives because of our responsiveness to the pandemic. But this is WHO promoting pharmacy and primary care pharmacy in particular. Please take note, this is WHO saying this. And if we needed, I can't think of a clearer message about how we really do need to develop our advanced services. We've been doing some work around the globe. This is an 88 country study we did where we looked at advanced practice development. And generally speaking, we need to move quicker in order to get some advancement going on. And we're developing a framework, if you like, about an escalator, how we move countries. I'm not talking about least developed economically. I'm talking about least developed from pharmaceutical care services point of view, how we develop more advanced community-based services in primary care settings. And that, ladies and gentlemen, is an educational challenge for sure. And we need to engage with this curriculum for advancement more fully. It's not just about students and initial education and training. Here's the Global Advanced Development Framework, which was launched by FIP a couple of years ago. Here's some work we did with the Indonesian workforce about where they are located along this advanced competency development framework, which you can view, if you like, as a form of curriculum. And you can see that certain areas of that curriculum, in particular education, training and development, and evidence-led practice, or certainly is falling short, perhaps, of where we should be. But this is common in nearly every single country that we've looked at. We're working at the moment with Jordan, with Qatar, with Ireland, with Iceland, with a whole range of different countries, and we're seeing a very similar picture. So Indonesia is not falling behind, but we are all part of a common challenge, all countries, including my own, in this respect. But we do need to start working harder with this advancement. I'm going to skip through this because I'm running short of time. My point about this slide was one simple message, and that is advancement and specialization in pharmacy. It needs to include general practice as a form of specialization. And that's a massive curriculum that we need to build, okay? It's not just about oncology pharmacists or renal pharmacists or HIV pharmacists. It's about advancement and specialization in general practice pharmacy as well. And we need some curriculum development there. So education and educational transformation needs to be part of a career journey. And that means developing acquisition of complex skills, competencies in order to meet this particular agenda. And we need to start recognizing some key issues. One of which I put right at the bottom of that slide there, and that is the location of leadership. Where are we locating educational leadership in Indonesia? Where are we locating educational leadership in the UK? Come to that. Where are we locating educational leadership in Ghana, in Jordan, in Peru, who we've recently been talking with? It's actually a harder question to answer than you might think. And it's something the university sector needs to be foremost and prominent in terms of national educational leadership for your national pharmacy workforce. There are tools that will help, and mechanisms and policy papers. Come and talk with FIP. As you're already doing, IAI is a key leader actually with FIP right now. They're doing some fantastic work in career development, competency-based development, but we do need to talk with each other more about what tools we're needing. We do have a systematic framework for development, the development goals, and we have many universities around the world engaged with these development goals right now, pushing forward the agenda, pushing forward the curriculum. But as I come towards the end of my presentation today, and to summarize my key messages, it is that curriculum is more complex than we think. And it's certainly not just the consideration of the content of our programs. It has to include a connection with the complexities of care. We are training pharmacists, obviously, for the purposes of providing healthcare. That's what we do. And we must recognize the complexities of those care now if we are to remain a valid and impactful contributor to healthcare gain in countries. We have transformation mechanisms. We should be using them more often, and we should certainly be reaching out into the foundation and the advanced development of our workforce. Universities should be playing a valuable component in that career-long development. Having data about your workforce is key, and you need to feed that data back into your curriculum development, which is what we're advising all countries to do right now. It's a harder thing than what you might think, but it is something that needs to be connected. And we need to be engaged as a university sector in career pathways, for sure. That is my curriculum summary. I've been low on detail, and very high on big picture and vision. But I do hope it will stimulate some debate for you. My last slide is about where do we go? Well, in my view, partnerships are key. So we can't be sitting on our own as a university sector, doing our own thing as a university sector. We do need to have partnerships with employers, those people who employ pharmacists and provide pharmaceutical care, be they hospitals, be they community pharmacists, be they government agencies, but those partnerships need to exist, and partnerships with professional leadership organizations as well. They are a key player. They have regulatory authority. They have leadership functions as well. We need to be working very closely in this triangle of the university, the healthcare sector, and the professional leadership bodies, because better training leads to better care, and better care leads to saving lives. And that's what pharmacists, the students that you are teaching, that's their destination, that's their aspiration. Good. Thank you so much for letting me speak with you this morning.
Thank you very much, Professor Bates. It's very inspirational that you also mentioned about the continuing professional development. So, and where the university should take parts. Okay, ladies and gentlemen, we come to the discussion session. If for those of you that has a question, you can write it down in the Q&A pods. And I would like to first starting from a question for Professor Lee from Victor Sahat Ringo. Pak ask to Professor Lee about the artificial intelligence. Yeah. Okay, Professor Lee. So artificial intelligence already applied in pharmacy student teaching in maybe he meant in Korea or still as the teaching concepts. So could you please maybe explain a little bit about that?
Yeah, thank you.
Yeah. Sorry, go ahead, please.
Thank you. Hi, Ian. It's nice talk. Yeah. Actually, utilization this AI is ongoing. So it's applying in many pharmaceutical sector. Even in Korea, we are contact many key leading the companies to develop AI program and accumulating and harmonize the big data to standardizing to be used for AI, because all databases is very different from hospital to hospital or research to research. All data is get together in the university, in my university, and also either harmonize or make it standardized. That's kind of big project. Also, you collaborating many AI company so that this system can be useful in drug discovery and development, even some assist some diagnosis of the diseases. So fortunately, my students is getting some this research is collaborating with medical doctor in the hospital, but still this AI information and system is not spreading in the pharmacy education yet in Korea. But someday this kind of the AI technique and the system should be used to upgrade the pharmacy education. I think so. Yeah.
Okay, is it already used in the university for like to educate the student, or it's only
not yet.
In the research yet?
Just in the hospital sector for the senior students is our pharmacy school is working together, joining together a medical school inside the campus. So it's going on there.
Okay, very interesting then. Thank you, Professor Lee. And the second question also from Pak Victor to Professor Ian Bates about the situation in Europe, whether is there more female pharmacists than males? Is it gender issues? How is it then?
It's an interesting, thank you so much. It's an interesting question and quite an important one. The species, which is a male pharmacist, is in decline, I'm afraid, all over the world. In Europe, some very high proportions of female participation, and it's growing. If you look at generally around the world, if you take an average, it's around somewhere between 55 and 60% of the global workforce is female. But if you look below that at the undergraduate population, there's probably around 10 or 12% higher. So in actual fact, this is a growing trend. There are some countries in Europe where female undergraduates are around about 90%, 90%. The region where there are fewest females in the workforce is probably Africa, but we have incomplete data for the African countries, but they seem to have the lowest female participation rate at the moment, but that is changing. Indonesia, like many, many countries, is having a growing female participation. I have to say this is not a pharmacy phenomenon. It's happening in medicine as well. Traditionally, it has always been there in nursing, but in medicine now, there were in Europe, there are probably more female doctors than male doctors now, and that's a growing trend also. So we're not unique, but my point is that it's important for workforce planning. We all want families and a social life, and the female members of our profession have to, are the ones who help us with our socialization and having families and such like. But they are highly, let's look at the equity agenda here. It costs a lot of money to train a pharmacist, a lot of money. There's a lot of training that goes into it. We do not want to lose, these valuable people, members of our profession. We need to bring them back to help people come back into careers. And also, women must not lose out on promotion and seniority either. They must not be falling behind male counterparts for promotion simply because they want to have families and children. And this equity agenda is a very important emerging agenda. You ask WHO, and they are very, very strong on equity and equality right now. From an educational point of view, we need to make sure that we adhere to that, and we have policies which enable that equity to take place. So it's a very serious question in actual fact. Thank you.
Okay. Thank you, Professor Bates. Also, thank you for to endorsing the female equity. Okay, we also have another question for Professor Lee from Mrs. Laitur Rahmi. She asked about the pharmacy schools need to do to develop curriculum that goes beyond fulfilling basic competence or licensure, because it seems that the pharmacist license when it become the goal, we are concerned about our graduate who can pass the exam, but it seems that it should be more than only to get the license, maybe something like that. How about this situation, Professor Lee?
Actually, the pharmacist license exam is just testing really basic knowledge and information. You understand? So, however, the function and roles of a future pharmacist must be beyond national license exam. So even to get licenses and to serve the society, however, our pharmacy education get more, the curricula to meet, the 4IR, fourth industrial, revolution, and also society needs that. So also to be the more competent or outcome basis, so we input more area. I mentioned the 4 core competence basis curricula that in my slide. So that's it, more than the national license exam. That's my point.
Okay. Okay, thank you very much, Professor Lee. And there is also a question. I think this question is really suitable to Professor Gerhard, because you mentioned about working collaboratively with other health professionals. From Mr. Setiadi Ihsan, he asked about in connection with the current COVID-19 pandemic. I would like to know in what extent the role of pharmacists and all stakeholders in the health sector in determining policies in dealing with the pandemics in their respective countries, and if there is an existing curriculum sufficient to equip the pharmacy graduate to be responsible for issuing the strategic policies. So Professor Gerhard, maybe you would like to share some opinion about this issue?
Professor Triana, could you please repeat, because I just got a call from our examination board at the university, and I did realize that you do talk to me, that you have talked to me, but I did not understand fully what your question was. Please. Yes.
Okay, so Mr. Setiadi Ihsan asked, what this pandemic situation, and so everyone needs pharmacists and all stakeholders in the health sector to working together, right, to determining policies in dealing with these pandemics. And do you think is there an curriculum which can equip the pharmacist graduate so they can be more responsible for in the issuing strategic policies, something like that?
Yeah, I think the issue with the policies, I think this was really a very, how should I say, urgent issue at the beginning of the pandemic here in Germany, at least, or also in Europe. So we were lacking a lot of documents that did help people to better understand how they should process certain activities and what they are responsible to do. But nowadays, so we have a lot of policies implemented already, but those policies are more of a general kind of document. That means, okay, they don't address specific activities specifically for pharmacists. So of course, pharmacists do play a role because they belong to the healthcare sector, but there is not a specific policy, to my best knowledge, let me say it like this, there is not a specific policy specifically addressed for pharmacists. Okay. Yeah. So, and the second part of the question, if I really did take it correctly, was if the pandemic did lead to changes in the curriculum for the pharmacy education. And at least here in Europe, it's really a tough exercise to update the curriculum. Yeah, because it needs to be approved, it needs to be accredited. So it's not something that you can just do out of the sudden. and then tomorrow you can start following the new curriculum. So it has to be prepared carefully and appropriately. So also, to my best knowledge, maybe universities do work on that, so that they do include certain modules that specifically address this kind of outbreak situations. But honestly speaking, I cannot tell you any specific example on it. Yeah, but what we did learn from that is that maybe because everywhere in the world we were not really prepared for it. Yeah, and now we know, okay, listen, we have to prepare for it, and we need to be prepared better for the next outbreak that might come, or most probably will come somewhere. So, and I guess that this pandemic will lead to curricular changes in the future, just coping with the specific elements that were currently lacking.
Okay, thank you, Professor Gerhard. And I think I have one question to Professor Yao, because you have brought out about the what's specific with the pharmacy and pharmaceutical sciences department. Is there any because in Indonesia it's quite difficult to implement this idea, because at the end we have a regulation that the one that works in pharmacy and also in industry as a supervisor has to have the license as a pharmacy or apotheker in Indonesia. How about in Singapore then?
Yeah, thanks, Professor Triana, for the question. Yeah, so in Singapore, it is a similar situation. In the pharmacies, of course, the pharmacists, the licensed pharmacists will be responsible. Yeah, so in the pharma industry, the responsible person, there should be at least one responsible person who is actually a licensed pharmacist. So that is also the same in Singapore. Yeah, it's just that the other professionals, pharmaceutical scientists, in those areas, they may not necessarily all need to have the license. Yeah, but just at least one responsible person would have to be licensed.
Okay. Yes. But is there any more benefit for the graduate from the pharmaceutical sciences in combination with the one with the license? Maybe is there?
Yeah, that's a good question. In fact, what we see over the years, when, before 2018, when we did not have the pharmaceutical science program, we do have a small group of students who are more keen on the pharmaceutical science aspect rather than in the direct patient care area. Yeah, so that kind of prompted us to want to cater to this group of students, and also driven by the local industry as well, that prompted the need for pharmaceutical scientists rather than those with the clinical pharmacy practice background. Yeah.
Okay, thank you, Dr. Yu. Okay, ladies and gentlemen, I think we are come closer to the end of this session. Unfortunately, we cannot discuss every question that come up. But before we close, I would like to ask for each of our speakers to maybe give us 1 or 2 sentences as a take-home message for us all. So we have a clue what kind of things that we have to prepare for the pharmacy education curricula. Maybe I can start from Professor Lee. Please, maybe you have 1 or 2 key home messages for us.
Okay. Actually, to restructure the pharmacy education for outcome basis or competence basis education, it's not so easy, the strategies. However, the environment, social environment, everywhere is drastically changing. I'm not mentioning fourth industrial revolution. So the key roles of pharmacists is to serve, to develop, the society or to, the new medicine. There are many roles. So there is there's so many, ways to upgrade the good quality of education. So before do that, every country get some different education system or the economy. Also, so many factors, as disease types or the peoples, So even that situation is not so good, but one by one, gradual upgrading of the pharmacist role is very important to satisfy the social unmet needs. Fortunately, the FIP or other AASP, other organization give us some kind of clue to assist any university in the world. So maybe school doesn't stay alone, maybe collaborate is open-minded for this society and school to interconnectivity, make much more stronger the future, the pharmacy education. That's my talk. Thank you. Yeah.
Thank you, Professor Lee. And from Dr. Yu, please.
Thank you. Yeah, so in terms of the training of the future pharmacists and pharmaceutical scientists, I think what is really very important in today's time is really about the transdisciplinary curriculum to really prepare them to be able to cope with the real world situations. And the other important aspect is about going out there into the workplace to go for internships. Experiential learning is really very important for our students to be equipped with those skills even before they step out into the workplace. Yeah, thank you.
Okay, thank you, Professor Yao. And I would also looking forward to hear from Professor Gerhard. Please, Professor. Hello, Professor Gerhard. Okay, he said that he has something also in between. Maybe Professor Bates, would you please to also share us one or two sentences for us as a take-home message, please?
Professor Lee and Dr. Yao are absolutely right in the synopsis. It is difficult to re-strategize a curriculum, but let me offer this. Competency-based education and training can coexist with, if you like, more traditional orthodox means of higher education for initial education and training. They coexist. It's not one or the other. It's a coexistence. My principal message would be to look beyond graduation and look at the opportunities offered by continuing to engage with the workforce. The university, look at the opportunities it brings in. It brings in a greater influence on shaping the career of pharmacists, which means better services for patients, newer services for patients. It means an opportunity to bring science as a more mainstream consideration for career development. Let's not forget our science is needed for all of this primary healthcare delivery. And if I may say so, I'm sorry for being slightly crude perhaps here, but it offers opportunities for revenue generation and working with others as well. Specialization, advancement, and maintaining a continued education connection, particularly working in partnership with bodies like IAI, is particularly important now. Okay, so I think there's a coexistence. I think partnerships is key, and I think it opens up opportunities. That would be my main messages. Thank you so much.
Thank you, Professor Bates. And Professor Gerhard, you were already ready for take-home message for us all before we close this session?
Yes, of course. Yeah, as Professor Bates just said, so from my perspective, it is, I think the take-home message is only one word, is interdisciplinarity. So, and what we should do, we should really collaborate, and we should make health our, how should I say, our common objective. Okay, and for this, we need to have different skills, different knowledge, we need to have different backgrounds, but at the end, we should be able to put all those activities together. And the WHO approach on One Health, on this initiative, I think this is a good, how should I say, a good signal. It's a good starting point whenever somebody is going now to remodule the curriculum for any health-related subject. So only for you to take home, only one word: interdisciplinarity. That's
interdisciplinary. I think, yeah, I cannot agree more. I think that's combined all the 4 speakers for the interdisciplinary approach. Okay. Yeah, I see that there are several questions, but ladies and gentlemen, I think we come to the end of this session. I would like to express my greatest appreciation to our distinguished speakers for the very excellent presentation this afternoon, for sharing expertise and experience. Thank you very much, and also thank you very much for all the audience for stay tuning with us for the last 3 hours. And I myself and on behalf of the organizing committee would like to apologize for any inconvenience during this webinar, and also not being respond to all the questions. I hope it's still, you are still motivated to go further for the second session in this afternoon. And before I formally close this session, I would like to quote from Charles Darwin, which I found as quite relevant to our discussion this afternoon. So Charles Darwin once said that it is not the strongest of the species that survives, nor the most intelligent that survives. It is the one that is most adaptable to change. So thank you very much, everyone. I hope you enjoy the rest of the webinar. Stay safe, stay healthy, and being happy, being motivated. See you. Bye. Thank you very much.
Bye.
Thank you.
Yeah, thank you very much, Professor Lee, Professor Gerhard, and Professor Jan Piet. Yeah, thank you very much. Dr. Wei Ping Weo, thank you very much. Yeah, Professor Jan.
We maybe have a photo session.
Yeah, okay.
We didn't have a photo session yet, right? I think that would be nice to have a photo session, right?
Right, sure. We can have it.
Okay.
Yeah.
Okay, thank you, Mbak Farida.
All right, so maybe Mr. Adiatmika, could you help me to take a picture for our session? Sure. Okay.
Sure.
All right, all the participants and all the speakers, can you please turn on your camera for our first session, photo session? So I will count it in 3, and 1, 2, 3. All right, one more time. 1, 2, 3.
Yeah.
All right. Oh, good. Thank you very much.
Thank you.
Okay, thank you very much.
Thank you,
Thank
Professor Lee.
See you later.
Thank you, Professor Gerhard, Professor
All
Ian
right.
Bates, and
Thank you very much, Professor Triana, for guiding us on our first session of today's webinar. And thank you very much for all the speakers in the first session with excellent topics and sharing discussion have been given. All right, and then we will have a short break, a very short break before we continue to the second session of today's webinar. And we will have 5 minutes break, and we will start for the second session of the second webinar in 5 minutes from now. Thank you very much and see you later.
Tarik napas dulu.
Thank you.
Enggak, seri yang pertama.
Hold me close and hold me fast. The magic spell you cast. This is La Vie en Rose. When you kiss me, heaven sighs. And though I close my eyes, I see La Vie en Rose. When you press me to your heart, I'm in a world apart, a world where roses bloom. And when you speak, angels sing from above. Everyday words seem to turn into love songs. Give your heart and soul to me,
and life will always be
La Vie en Rose.
Quand il me prend dans ses bras, il me parle tout bas, je vois la vie en rose.
Every time you kiss me, heaven sighs.
Il me dit des mots d'amour, des mots de tous les jours, et ça me fait quelque chose.
If only you would give your heart and soul to me, and life will always be La Vie en Rose. une part de bonheur dont je connais la cause. C'est toi pour moi, moi pour toi dans la vie. Elle me l'a dit, la journée pour la vie. Give your heart and soul to me, and life will always be la vie en rose.
All right. Yeah. Okay, good afternoon and welcome back. And we will move on to the second session of our webinar today. And we will, the second session will be guided by our moderator, Mr. Nofrizal Abdi Sahid, PhD. He is the Secretary of Undergraduate Program, Faculty of Pharmacy, Universitas Gadjah Mada. So, Mr. Nofrizal, time is yours. All right. Okay, hi. Hello, Mr. Nofrizal. Are you there? Oh, I'm sorry. So we will still waiting for Mr. Nofrizal as our moderator for the second session. Hello, Mr. Nofrizal. All right. Okay, Mr. Nofrizal, time is yours.
Hello, can you hear me? I'm sorry.
Yes, yes, sure. Okay.
Okay.
Yep.
Good afternoon, everybody. I'm sorry. Today we will start our second session of the seminar. Because we start behind schedule more than 20 minutes, I would like to introduce the first speakers of this sessions, Dr. Ian Larsen. Dr. Ian Larsen is the Director of Learning and Teaching in Faculty of Pharmacy and Pharmaceutical Science, Monash University, and he has developed several platforms for teaching and learning, especially using the technology information platform. And now he is the senior lecturer in the Monash University Faculty of Pharmacy and Pharmaceutical Science. And because we a bit late in the start, maybe you can start your presentation, Dr. Ian, for 30 minutes. Time is yours.
Thank you for the kind introduction, and thank you to the conference organizers for allowing me to speak at your conference. I'll just share my slides. Hopefully now you can see my PowerPoint slides. Yep. Okay, so as Mr. Nofriza said, my name is Ian Larson. I'm at the Monash University, Faculty of Pharmacy and Pharmaceutical Sciences in Melbourne, Australia. I'd like to talk to you about Pharmatopia. Pharmatopia is the name for a simulation that I've developed over the years, and I'd like to talk to you about partnering with industry and partnering in industry in a few different ways. First of all, to help prepare our students for work in industry so they're better prepared when they start, if they start an industry job. Secondly, to get input from industry experts into our teaching. They're industry experts that, of course, know much more about some specific details of pharmacy than what we academics do, and so it's really good to collaborate with industry experts and get input from their skills and their knowledge into the material that we develop for our students. And thirdly, the tools that we developed, industry is also using to train their own staff. So we are helping to prepare students for work in industry, but industry is also training other staff with some of the activities that we are co-developing with them. So it's a win for us and a win for the industry collaborators as well. And I'll explain how that works as I go through my presentation. First of all, I'd like to explain our education philosophy when developing new education initiatives, or when we want to change our teaching and we want to improve our teaching because either we think the students aren't learning as much as we want them to, or they don't find the learning engaging, or for whichever reason it is, the normal reasons when we want to change our teaching. And our philosophy follows this, this idea that the first thing we need to think of, and we need to spend much of our time thinking about, is the pedagogy, is what do the students really need to learn about this? Not being biased by what they've learned in the past, and but using everything that we know and talking with experts around what do students really need to know? What can we define really succinctly and really with great clarity? What are the learning objectives or the learning outcomes our students need to have? And as I said, this might be different from what it's been in the past. So we don't need to necessarily stick with tradition if we think that there's a better way to do things, or in fact, there's some slightly different things that our students need to learn. So the first thing we need to do when we're developing our education program is make sure we have the pedagogy completely determined, as I said, with great clarity before we do anything. The second thing that we then need to decide is in what space will the students do this learning? That space could be a physical space, it could be a laboratory, it could be a workshop room, it could be a lecture theatre, or it could be an online space. So it could be online video, it could be online text, it could be online interactive activities. So what space is it best for the students to learn in? Do we need to keep to our physical spaces that we might have on campus? Certainly now in the COVID environment we're in, then certainly in Australia, we're doing much more online teaching. And so then there is much more online space, but we need to use that efficiently as well. And we need to do that in accord with what our pedagogy is. So once we have our pedagogy determined, that helps us determine what space the students should do the learning in. And then lastly is the technology. So which technology do we need to use to support it? And the technology could be whiteboards, it could be projectors, or it could be online pedagogy. Do we need them to use special software or Zoom or whatever the technology might be? But the technology we don't think of first. So many people, including me, like technology and like using technology, but that shouldn't be the driver for a change in education. we first have to have the pedagogy agreed and clarified. We then need to think in what space the students do the learning. And then lastly, we need to think, well, what technology needs to support the learning in that space with that pedagogy. So not letting the technology drive it. I'm sure we've all had examples where we find someone using a new technology, but really they're just using the new technology because they want to. It's not really adding to the students' learning by using the new technology. So we want to make sure that the technology is suited to our pedagogy and to our space. So that's the first thing we need to do. The example I'm going to give for that, as I already alluded to, is Pharmatopia, and that's a tableting simulation. So first of all, in Australia, our accreditor is the Australian Pharmacy Council, and they set the standards for our pharmacy curriculum, and that's who we need to accredit our course. And so they have certain standards, and they have a standard about the formulation and compounding of medicines, as it says there on the screen. And so that has to inform our pedagogy. We're doing a degree that is accredited by an external body. And so we need to make sure that what we're teaching our students then, of course, exactly fits with the accreditation standards. And here is the relevant standard to tableting in Australia. And so that's what it says. So what did we used to do in the past before Pharmatopia came along, before I developed this simulation? Well, here was our traditional approach. And this was for all of our pharmacy students. They would have some lectures, of course. So that would be on powder theory, that would be on mixing, compression mechanics. They do a lot of physics around the compression during tableting. And then, of course, the quality assurance tests that tablets need to undergo once they've been made and before they can get released from manufacturing. So they'd have some lectures on that. And those lectures would be supported by, for our students, it was 3 laboratory classes. Each laboratory class was 3 hours long. They would mix some powders, so they would have real powders, they'd have real drug, they'd mix them, they would then granulate them. We had some tablet presses, and then they would press the tablets. So they were actually physically making tablets. The tablet press was, of course, was not one that was used in industry. It was a sort of a demonstration model. It was good for understanding tableting. It was not one of the more industrial high-speed tableting machines. But they would mix the tablets, they'd do some wet granulation, they'd do some compression, and then they'd do all the quality assurance tests. And our students had done this for many, many years. So 9 hours of laboratory classes and 4 hours of lectures, many, many years. This grew to be a problem as, first of all, as health and safety caught up. Because we were using heavy equipment, the tablet press was a big piece of equipment that could cause danger if you used it inappropriately. And so then the university health and safety said, well, the students haven't been properly trained to do all of this heavy machinery, and so therefore they can't use it. They'll just have to watch a trained person using it. So then rather than students getting the experience of running the equipment, they would need to watch a trained person use the equipment. Secondly, the university said, well, we can't actually let the students touch any real drug powder, any real drug, because what if they put some in their pocket? What if they accidentally inhale some? What if they accidentally swallow some? They get some on their fingers and they wipe their nose. So all the safety reasons around using real drug. And so then we had to replace the drug with an inert material, and we replaced it with lactose. Of course, we didn't tell the students that. The students would think it was not very useful if we told them they are making sugar tablets. So we kept the label on the bottle that and we told them they're actually making real tablets, so they would keep engaged. Of course, this became a problem when they went to do their quality assurance tests, because rather than measuring the amount of active that was getting dissolved from the tablet, there was no active there. And so for the quality assurance tests, we had to reach into a cupboard and actually get some commercially made tablets, and then we could do the quality assurance tests on those. The students would, of course, ask, well, why aren't we doing our tablets? And we would simply say, well, you made them so well that they won't dissolve in the time frame that we have this experiment for, and so therefore we need to use some commercial ones which will dissolve more quickly. It didn't take very long for students to work out that there was something wrong with that. So the students over a number of years went from actually physically making tablets themselves to watching people make tablets. And then, as I said, they couldn't even test the tablets that they watched being made. They need to test commercial tablets. So a lot of the learning that the students were getting was disappearing as mainly health and safety, but as other practicalities crept up on our students. And I looked at this and I thought, well, perhaps this isn't any longer the most useful exercise. So then, following our pedagogy, space, technology approach, let's apply that philosophy to then what we might do in the tablet place instead by replacing these 9 hours of laboratory classes and 4 hours of lectures. So looking at the accreditation standards, what do we want the students to do? Well, we want them to understand why the excipients, the inert raw materials, are in a tablet. And so then, of course, they know why the drug's in the tablet, and our pharmacy students, like every pharmacy students, they know a lot about the active ingredients, they know a lot about their pharmacology, a lot about their chemistry. So the students were completely fine in knowing about the active ingredient in the tablets. But what they weren't learning was, what are the inactive materials there for? What do they do? And so that was what we decided was our main learning outcome for the students, was for, at the end of the activity, for them to learn and to be able to explain what the role of the different excipients are. Why are they in a tablet? So that was the pedagogy. Space, we said, well, physically to do that in the space, if we want students to learn what different excipients do, then rather than just making a single type of tablet, in fact, we need them to make many different types of tablets, so they can actually see what the difference is when you change the concentration of certain excipients. Then they can see what change that makes in the tablet. And we simply didn't have the space all the time in our curriculum for students to do that in a real laboratory space. And so therefore we had to think about doing that in a virtual space, doing it in an online space, some interactive online space. And then we came to the technology. So what technology allows us to do things in a virtual laboratory? How can we do that? At the time, and this is quite some years ago now, more than 10 years ago now, Second Life was then growing in popularity, and it was a commercial program, a commercial 3D virtual world where you could log in at no cost to your own, download some software, log in, and you could have adventures in virtual worlds that people would build. And so we thought, well, that's a good idea. It's a 3D virtual space. We could build a tableting laboratory in there, so we're not restricted by physical space anymore. And because we're doing it virtually, then of course we can speed everything up. We don't really need to wait for the 30 minutes for the powder mixing to happen. We don't really have to wait for the 15 minutes it takes to do the tablets. We can do those things in an instant because it's only virtual. So we started off in Second Life, and I'll show you a quick video to show you what that was like. We then moved on to another virtual world, and then finally we ended up with a SCORE module, and I'll explain those are in a minute. But I'd like to just stop sharing my slides now and share you a video of what this Second Life 3D virtual world was like, virtual tableting laboratory was like. Okay, so hopefully here you can see a person about to enter a virtual laboratory. So this is, of course, a video taken of me when we had this virtual laboratory, and I'll go through, and I won't play it for very long, but I'll just give you an idea of the experience the student has. So to set the scene, each student would log into Second Life, would give them the address of our virtual laboratory, and then that would take them to this laboratory, this virtual laboratory, and they'd go into the virtual laboratory, and then they would proceed to make tablets, and then they could do their testing of tablets in this virtual laboratory as well. But I'll just play a little bit of it. So first you can see, so it's like a computer game. For things to happen, then you can hold the mouse over them, and that will show you what the function has. And then when you click the mouse, then you can see I've opened the door. And like all real manufacturing laboratories for tableting, then there's an airlock. Now, of course, we've simplified this. We didn't exactly build a manufacturing plant. We wanted something that students could look at and could understand. So we had big labels so they could see things, they could go up. So again, we're not replicating a real industry environment because our learning outcome is not to know how to work in an industrial environment, but it is how to understand what the different excipients do. So you can't see it up in the corner of the screen there, but what I'm doing is I'm clicking on each of the materials, and then I need to select what percentage of that material I need to use. And then it asks me, do I want to keep that percentage or not? So I've gone along and I've selected the percentage or the concentration of all the materials that I'm putting in my tablet. So selected the raw materials, the powders. The next thing we'd need to do is to mix them. And so here is a replica, a scale replica of a real industrial powder mixer. This is the cube mixer. You can see here, I'm just making sure I've got all my samples there. I've got the raw materials there. And I need to take all the raw materials and I need to put them into the mixer. So of course, we can't physically do that. And so it's just a drag and drop. All the raw materials at the percentages that I just selected, I need to drag them and put them into the mixer. And you can see there that the materials are appearing on the mixer. Okay, there's all my raw materials into the mixer. Now that they're all there, I can get the cube mixer to run. So of course, as you'd see there, the mixing time, of course, this is virtual, so it's just counting down. That's rotating at the speed. In fact, if we had the sound going, it would be making the exact sound that the mixer would make. It's 3D, and so if I wanted to, if the students want to, they can walk all around it, they can look down the top, they can look underneath. It's completely 3D, accurate 3D model of a real one. But of course, it's much quicker and much easier for the students to do. So now they've mixed their samples, they need to press the tablets. And so again, we've had to do the drag and drop. In this case, we've dragged things onto that platform there, and then our tablet press works, and now it's pressing our tablets. Again, this is a commercial tablet press. It's modeled as close as copyright allows to a real commercial tablet press. Again, it's 3D, so students could go all around it. They could go up close. It has got a safety screen on it, so the students can't interact with it. It's working just like a real one. But then again, it only takes a few seconds for it to complete its tablets. And then we go into our quality assurance room. And here we have what our laboratory equipment looks like in our faculty. So this is what our hardness tester looks like. And you can see here, I'll go through and I'll start doing some measurements. So I'll just leave that there. But you can see it's an interactive 3D. It's like a computer game. You walk using the arrow keys, use your mouse to activate things. You go through, there are even big numbers on the floor that you can see which follows. So there's a guided path. So you go, okay, do this, do this, do this, and do this. Okay, let me stop sharing that screen and going back to my slides. So we started off using Second Life, and that was a hit with our students. Our students loved it. They would all go in, whether they were from home or from the library or from one of our computer labs, from a computer lab at a different campus, from a shared computer somewhere else. They would log in, they'd be in there together. So it was a multiplayer virtual world. So the students could all log in. There could be 20 or 30 of them in the laboratory at one time, in the tableting laboratory at one time. There would be a queue behind some of the pieces of equipment because everyone was waiting their turn to use things. So there'd be a queue. They could talk to each other by chat. And so even if they're in different places physically, virtually they're logged into the same place. And so they could chat to each other while they're waiting in the queue to get their turn at a piece of equipment. Students thought it was great. Once they'd finished their tableting exercise, they'd go off and explore other parts of the world, and they could get dress up as dragons or as witches or as wizards or whatever they might be and explore the world. So the students really, really thought that it was a fun, engaging thing to do. They loved it. Unfortunately, the downside was that Second Life although the software was free, of course, it was owned the Second Life company. And of course, they weren't building their software to attract people like us, attract educators. They were building it, they wanted it to be a 3D virtual Facebook meeting place. And so they kept on changing the code so that they could try and increase the engagement for students or for people who would go there socially. Sometimes those changes in code would conflict with what we were trying to do in the laboratory. So some students might log in one day and everything would work. The next day they'd log in and there'd been an update to the code and the tableting laboratory would no longer work. And so then we would need to cancel that activity. We'd need to find some contract some IT staff to recode our tableting lab so it could work, and then we'd get the students to do the activity again. And that happened not very often, maybe a few times a year, but that was enough. That became very, firstly, disappointing for our students, but also it was becoming expensive for us because we'd have to get contractors to develop to change the code all of the time. So we moved from Second Life. We thought, okay, we want an interactive 3D world, but we don't want Second Life. And so we decided to build it actually as a game rather than a social world that Second Life was. Let's actually build a computer game using a computer game engine. And so we'll build an interactive world where we can, just like a game, we can distribute it, the students can download it and they can run it just like a game. And we did that using Unity 3D game engine. And that offered, it was still a 3D world. The students could still go there and interact. But it didn't let us do everything we wanted to. Unity was built as a game. Again, it wasn't designed for an education tool. And so there's some things that our students couldn't do that we wanted them to, that was necessary for their learning. So whilst again, the students enjoyed it, it didn't meet our pedagogy. It was good technology, the space was good, but because of the limitations of the technology means we couldn't really meet all of our pedagogical goals. And so then after a few years, when we realized that there was no way we could change that, and the students weren't learning what we wanted to, then we changed again. And we changed to a SCORM module. So for those of you who don't know, SCORM modules, that's an international standard, and it's activities which are sort of plug and play activities designed to use in learning management systems. The learning management system we used at the time was Blackboard. Now we use Moodle, but similarly, these SCORM modules are designed so they can be put in different kinds of learning management systems and they'll work. And so I'll now show you screenshots from our SCORM module. So the first thing is, if you can remember our pedagogy was our main learning outcome was for students to learn what the different excipients do, what the different raw materials do, what they do in a tablet. Why are they there? Why do we add a binder? Why do we add a disintegrant? Why do we add a lubricant? And so our goal was, we thought, well, if we get them to make many different tablets with different amounts of binder and disintegrant and lubricant in them, then they'll be able to see how each of the different tablets behaves. And then they'll be able to understand that a change in the binder changes this property in the tablet. So that was our learning design. So when a student logs in, they'd log into the SCORM module and they would see this slide here. Each student would be given an individual tablet. We encourage our students to learn collaboratively, but we know that sometimes students take that a little bit too far. And what we're trying to do is make sure if each student has their own tablet to make, then they can't just borrow their answers from their best friend, because each tablet will have its own properties. And so what the students need to do, as it says there, each student has a specific tablet to make. The tablet is not defined by the active ingredient. It's not defined by the drug. As I said, our students know everything about the drug part of things, but it's defined by the physical properties that we want the tablet to have. So a disintegration time, a hardness, a dissolution, and an abrasion of friability. So our students, they would have this, and we would ask them to write this down in a lab book, or at least in a notebook, so that was their goal. What they had to do was make a tablet with exactly those properties. Once they had that, then they'd move on to be able to select their ingredients. So again, this is similar to what you saw in the movie before in the Second Life version. We have our different excipients we can have there. And again, we would click on them to choose. And it says there's always instructions, bottom right of the screen. Once we're here, we need to collect our ingredients. And just like in the Second Life version, we would click on things. We'd click on the lubricant and it would give us a range of a number of percentages of the lubricant that we would need to choose from. And there'd be 5 choices. So 5 different choices of lubricant, 5 different choices of disintegrant, and 5 different choices of binder. The active ingredient, we didn't specify that because of course different tablets have different amounts of active ingredient. And the filler, we just made things up to 100% with the filler. So the student would have no idea that they would go, well, to make this tablet, I don't know. So they just choose things at random. They just choose a concentration for the lubricant, choose a concentration for the disintegrant, and choose a concentration for the binder. And once they did that, then they'd go through and test that tablet. So after they'd selected their ingredients in the level, and now if you look at the top of the screen, you can see on the right-hand side, that's the tablet that they need to make. There's the disintegration, hardness, time, and dissolution. Even though we get them, we encourage them to write it down because we say this is a virtual practical exercise. So just like in a real practical exercise, you should be writing everything down in your lab book. But we're keeping it there for the students that don't do it, up on the top right-hand side of the screen. Also at the top of the screen, you can see the levels of the raw materials they've chosen, 0.7% lubricant, 4% disintegrant, 1.2% binder. So that's just there just in case they haven't written down or they forget what it is because it's not possible to go back. Once you've selected all your ingredients and you move to this screen, and of course you can't move to this screen until you do select all your ingredients. Once you've selected all the ingredients, then you automatically move to this screen. And so then you have all the ingredients, you please proceed to the mixer, and then you'd click on the mixer and it would rotate just like the other one. Again, it would only rotate for a few seconds. So you get an idea of what the mixer does, but you're not limited by the real time it takes. And lastly, just like in Second Life as well, after we've mixed them, we go to the tablet press. Again, once the mixer had finished, it would automatically move us to this screen. And then we would click on the mixer, click on the tablet press, click on the tablet press and our tablets would be made. And then again, we could go through and do the quality control testing. Now you can see there, once you've clicked on all the instruments, then the test results now appear at the top. And you can see that the disintegration time is correct, the hardness is incorrect, and the dissolution is incorrect. So what a student needs to do now is needs to think, okay, well, there's the level of the raw materials I had. There are my results. Some of those results are wrong. Let me make another tablet and let me change some things this time and see how that changes the test results. And let's see if I can make the tablet that I need to make. So they would make a number of tablets. Indeed, most students would make between 10 and 15 tablets. It takes students about 3 to 4 minutes to take a tablet. So most students in this simulation would take about an hour to complete this exercise. At the end of that, they've made all the different tablets, and what they've needed to do to solve the problem is they've needed to work out which ingredient controls which property. So they've learned that in this case, the lubricant is controlling the level of hardness. Lubricants, we know magnesium cerate's the most common one. It's a wax. So the more wax you add to a powder, the softer the tablet gets. So students would go through and by trial and error, they would work out which ingredient is controlling which result, which property of the tablet. And that was the learning outcome we wanted. Students couldn't share their actual answers because they all had a different tablet to make. But what they could do was they say, well, we think the lubricant does this. I think the lubricant does this. I think it changes hardness, but quickly do some experiments and just check that. Keep everything else the same, but change the level of the lubricant. 6, 7, 8 minutes later, they've done 2 or 3 different experiments and yes, they can prove to themselves that the lubricant is controlling the hardness. And that's reinforcing the learning. And so now this is the version we have. This score module. Now, where does industry fit in? Well, when we made that video I showed you before, the Second Life video, when we had that video, we thought, well, this Second Life tool, this is a pretty special tool that we've built here. It cost us some money to build, cost some development time, some programmers who had to come and do the coding for us, but our evaluation of the tool shows it was very effective. Students really enjoyed it. They were meeting our learning outcomes. Our learning design was a strong learning design. And we thought, we want to share this. We want to share this with other universities. So we shared that video with universities that we collaborate with closely. And they could then show their staff, and their staff might say, well, let's use this in addition to our tableting pracs, or let's use this instead of our tableting pracs, or let's use this as optional material for our students. And so there was a number of universities around the world that did that. And we would share the program with them. We would share Second Life with them, the address and the instruction and everything with them freely. One of those, yes.
I'm sorry to interrupt your talk. You have still have 5 minutes. Thank you.
5 minutes. Okay.
Okay.
Thank you very much. So we shared it with the university, and the university shared it with some of their alumni. And one of their alumni is a very high-ranking person within global manufacturing and supply within GSK, GlaxoSmithKline, the pharmaceutical company. He saw it and he thought it was fantastic. He thought it was great. He wanted to use it to train his staff. So he contacted me and said, I've seen your tableting simulation. I want to use it for our staff. And I said, yeah, that's completely fine. But he goes, I want to build some other ones as well. You've done tableting, but I want to do capsules. I want to do grinding. I want to do other things as well as just tableting. Can you help me do that? And so then we work collaboratively together. And so GSK, they now use this simulation. In fact, now they use this SCORE module. They've used the SCORE module. They use it around the world to train their staff. They have funded us to build other modules as well, and I'll go to those in a minute. Funded us to use those other modules as well. And so that meant that we used outside funding to fund modules that our students could use. That's a win for our students. It's a win for industry because they have used our educational expertise to create activities that their staff learn from. And we've had input from industry in designing these new modules because that's what they're the experts in. So just to go through the evaluation, you see lots of students, they understood the relationships, exactly what we want. They thought it was aligned to learning activities. They understood the tablet manufacturing process and they really enjoyed it. The reality of using the machines to mix compressed tablets and testing the properties were very visually useful in understanding the tablet manufacturing process. Helped to understand more that can't be learned from notes and textbooks. So the students really enjoyed it, and I've said that before. So here are the other modules which industry created, industry paid us to create. There's an advanced tableting one, granulation field coating, roller compaction, and encapsulation, as you can see there. So industry wins because our students are better trained for jobs in industry. Industry wins because they've used our educational expertise to build modules for which they can train their staff. Our students also win because we get input from industry experts in designing the activities that our students could do. So it's wins for the students, it's win for us academics, and it's win for industry. So that's the end of my talk. Thank you for listening. And questions, I guess we wait for the panel at the end.
Yeah, thank you, Dr. Ian Larsen. It's very interesting talk. Yeah, I think I just wondering how long you developed this pharmacopoeia system. Yeah. Maybe later you can tell us in the question and answer session. Thank you very much. Okay, next I would like to welcome Dr. Neni Nuraini, the next speaker of the session. Dr. Neni Nuraini is the researcher and senior project manager of Research and Development Division at PT Bio Farma, leading manufacturer of vaccine and other biologicals, drugs or therapies in Indonesia, and is involved in a number of drug development, including biosimilar, and recently also involved in the COVID-19 vaccine development in Indonesia. Okay, Dr. Neni Dr. Neni will present in Indonesian. Okay, please.
Okay, thank you. Can you hear me? Pak Nofrizal?
Yeah.
Okay. So I would like to thanks to University of Gadjah Mada, Professor Agung, that invite me to this very important seminars. So please allow me to talk in Indonesian language since I'm not prepared for the seminar. So I'm sorry for that. So this is the, I would like to share about the recent progress of biomacromolecular research in industry. Let me share my screen. Okay. Okay, can you see my screen? Okay.
Yeah.
Okay, Assalamualaikum warahmatullahi wabarakatuh. So as mentioned by Pak Nofrizal, I'm Neni Nuraini from Research and Development, PT Bio Farma, one of the vaccine manufacturer in Indonesia. So this is my contents of this seminar about the challenge in drug development in Indonesia, and then second is about the healthcare industry after COVID-19, and third about the innovation of the pharma R&D in healthcare product. So most of the slide is in English. So first I would like to talk about the challenge in drug development in Indonesia. So the challenge in Indonesia is of course the compact of the process, and the second is the lower of the success rate, and also the innovation related. So we lack of the innovation in the pharma industry, and then of course the import dependency. So as we know that this process of the pharma R&D to be a product is very complex. So starting from the exploratory phase, and then the preclinical trial, we have to do the adjuvant selection, for example, in the vaccine development, immunogenicity studies, safety studies, and potency assay development. Of course, after the preclinical trial, we have to go to the clinical trial phase 1, phase 2, and phase 3, and it is needed about 5 until 6 years to do that. In the manufacturing side, product, process, and formulation development will be done. So starting from the lab quality to get the technology transfer, R&D to GMP, and adaptation to new manufacturing condition, antigen production and delivery system, establishment, vaccine formulation, and manufacturing of free GMP batch for the safety studies. And then going to manufacturing early development and first batch manufacturing, of course, include the upscale of the manufacturing GMP, equipment qualification, and critical analytical assay validation. And then move to manufacturing development. So we have to produce our drug or vaccine in the GMP grade product, and then full equipment qualification, full analytical assay validation, and established manufacturing process. So this is, of course, you need time, and then, of course, regulatory clearance is needed. So the challenge of the drug development is, of course, the lengthy and complex and costly of the process, and also the unknown pathophysiology for many diseases makes the target identification also challenging, and regulatory pressure. And in one article, it said that innovation and regulation are inversely related. So as you know in this slide, the development success rate is going, as you can see, the success rate for the first approval may be reduced until the registration only 1 or 2 pharmaceutical drugs. Yeah. I'm sorry, I have to supposed to speak in Indonesian. So So this is the pharmaceutical industry characterization. So the high cost, risk, long term, highly regulated scientific base, and also the most important thing in Indonesia is more than 90% of raw material Indonesia is import, ya. So jadi kalau kita tahu bahwa 90% semua bahan baku di Indonesia itu import, ya, masih import, termasuk API. Jadi kalau kita melihat dari sisi development gitu ya, produk itu kita akan lihat dari sisi global, nasional, dan juga industrinya. Dari sisi global, as you can see here, di sini kita lihat bahwa hampir kita lihat ada perubahan gitu ya dari sisi penyakit yang ada di dunia, ya. Jadi orang itu, manusia itu yang tadinya infectious diseases menjadi lebih ke arah non-infectious disease gitu ya. Jadi di 2030 kita akan lihat bahwa cancer, ischemic heart disease, cardiovascular disease akan lebih banyak dibanding infectious disease, ya. Yang tersisa itu mungkin hanya tuberkulosis, HIV, dan malaria gitu ya. Dan tentunya kita tahu bahwa ada anak-anak masih sangat tergantung pada penyakit-penyakit yang lebih ke arah infeksi, ya. Jadi Bapak Ibu, jadi di dalam pengembangan obat itu kita mekanisme aksinya bisa di level organ, bisa di level jaringan, bisa di level sel, atau bisa di level DNA atau RNA. Nah, jadi kalau kita lihat, misalnya kita memberikan secara sistemik untuk pemberian, untuk mendevelop obat yang terkait dengan imun sistem, kemudian ada tissue engineering, kemudian therapeutic drugs, bisa kimia maupun biological, bisa juga enzim replacement atau antibody, sel terapi, dan gene terapi. Jadi kalau gene terapi itu lebih ke arah DNA, sel terapi kita treatmentnya di sel. Jadi biomakromolekul yang therapeutics yang biasa kita lakukan, itu yang kita kembangkan, terutama di Indonesia, kita sekarang Bio Farma itu masuk ke life science industries, ya. Jadi ada protein terapeutik seperti monoklonal antibody, kemudian biosimilar, blood product, dan mungkin sekarang sedang tren juga CAR-T imunoterapi. Kemudian regenerative medicine seperti stem cell dan gene terapi dan vaksin, ya. Nah, jadi kalau kita lihat memang biologi itu lebih kompleks ya dibanding small molecule. Jadi ini tentu tantangannya sangat banyak sekali. Jadi kalau small molecule kita anggap kita membuat satu molecular weight 180 Dalton, tidak ada asam amino seperti kita membuat sepeda gitu ya. Namun kalau kita membuat simple biologic seperti kalsitonin, ini molecular weight-nya sekitar 3.445 Dalton dengan 30 amino acid misalnya, dan ini tanpa memerlukan modifikasi dari hostnya seperti yeast atau bakteri, ya. Jadi seperti kita membuat mobil, namun kompleks molekul yang besar, biomolekul yang besar itu seperti monoklonal antibody, tentu ini molecular weight-nya sangat tinggi ya, 150 Dalton dengan 1.300 amino acid. Tentunya ada host modification yang menyebabkan terjadinya perbedaan fungsi dari monoklonal antibody akibat dari glikosilasi yang berbeda, ya. Sehingga memang banyak sekali monoklonal antibody akhirnya diproduksi di mammalian cell gitu, yang glikosilasinya hampir sama apabila digunakan atau diproduksi di manusia. Nah, kalau kita lihat trennya, evaluasi dari pharma trend gini, kita lihat bahwa small molecule itu cenderung menurun ya development-nya. Jadi lebih banyak biopharmaceutical itu yang naik. Jadi kalau kita lihat yang akan mendominasi produk farmasi ke depan adalah biopharmaceutical product ya. Jadi lebih ke arah biological product. Namun biological product itu kompleks sekali. Jadi teman-teman di farmasi mungkin terus terang ini juga harus mulai ajarkan gitu ya ke mahasiswa gitu bagaimana memproduksi produk biologi karena ini nanti akan menjadi tren ke depan. Jadi kita memahami bahwa cloning itu penting dalam memilih DNA-nya, kemudian ekspresi sistem yang akan dipakai itu apa saja gitu, apakah dia bakteri atau yeast atau sel mamalia, kemudian kultivasi itu atau fermentasi itu penting karena perbedaan dari kondisi fermentasi ini menyebabkan perbedaan dari protein rekombinan yang dibentuk atau produk byproduct-nya ya. Kemudian kalau kita lihat juga protein production-nya, pada saat kita membuat protein production ini dengan berbagai feed medium dan kultivasi kondisi yang berbeda, tentu akan memberikan variasi yang berbeda pula. Dan tentunya proses purifikasi yang mungkin meng-increase agregat, terjadinya agregat dan formulasi yang tentunya ini sangat penting kita pahami di teman-teman di farmasi untuk agar obat-obatan ini stabil ya ketika diberikan atau ketika disimpan. Nah, global biologic itu kita lihat bahwa protein itu mendominasi, kemudian disusul oleh vaksin, dan terakhir adalah sel terapi. Walaupun vaksin hanya 20%, tapi revenue dari vaksin itu memang 65% dari market share ya. Jadi besar sekali, apalagi sekarang COVID-19 mungkin semua orang ya menjadi familiar sekali dengan vaksin. Nah, untuk global biological market, kalau kita lihat ini adalah komposisinya. Jadi Bapak Ibu mungkin sudah mulai bisa mengenalkan ke teman-temannya gitu ya, atau ke staffnya, ke juga mahasiswa-mahasiswa terkait dengan obat-obat untuk onkologi, immunological disorder, hematological disorder, infectious disease, kardiovaskular, dan penyakit-penyakit yang lain, tetapi ini bentuknya bukan chemical base, tetapi base-nya itu monoklonal antibody, vaksin atau rekombinan protein, atau bisa antisense, RNA interference. Nah, ini menjadi satu hal yang akan menjadi tren di ke depan ini. Nah, kalau dalam vaksin sendiri kita lihat bahwa kita melihat ada WHO vaksin pre-qualified list ya. Jadi di dunia itu ada yang namanya list yang dikeluarkan oleh WHO setiap 2 tahun sekali. Nah, ini menentukan pengembangan kita di industri. Jadi riset kita di industri itu di-drive oleh salah satunya adalah list dari WHO ini ya. Termasuk misalnya kalau kita lihat bahwa kita ingin mengembangkan yang high priority, misalkan untuk yang hexavalen, vaksin dengue, HPV, malaria, MR gitu ya, rabies, rotavirus ini termasuk yang high priority dari vaksin development. Nah, bagaimana dengan Indonesia sendiri? Kita tahu bahwa Indonesia itu per kapitanya sekitar 11.240 ya, sumber datanya masih 2018, memang saya cari-cari juga belum banyak update-nya. Kemudian yang terkait life expectancy 71 untuk wanita dan untuk pria 67, dengan kematian pada pada bayi itu sekitar 31 dari 1.000 kelahiran. Jadi masih sangat besar ya kematian pada anak. Dan kita tahu bahwa health expenditure dari Indonesia itu sekitar 17 triliun. Jadi kalau kita jumlahkan semua farma di Indonesia itu hanya sekitar 20 triliun. Berarti kan yang lainnya itu adalah impor atau kita expand devisa kita untuk membeli obat ya dari luar, atau teman-teman kita mungkin berobat di luar. Nah, ini sebenarnya kesempatan buat farma Indonesia untuk meningkatkan produk-produknya supaya bisa digunakan oleh masyarakat secara luas ya. Jadi kalau kita lihat, kita itu double burden disease ya. Jadi selain kita masih ada communicable disease, kita juga ada penyakit-penyakit lain seperti kardiovaskular dan juga diabetes serta kanker. Jadi diabetes termasuk yang Indonesia itu ke-7 di dunia ya, mungkin antara 5 dan 7 rankingnya naik turun. Namun ini harus diwaspadai karena nanti 2030 sekitar 21 juta orang ya terkena diabetes diperkirakan di Indonesia. Nah, terkait dengan regulasi pengembangan industri farmasi, kalau kita lihat ini sudah ada regulasi yang mendukung industri farmasi gitu ya. Jadi rencana induk pembangunan industri nasional, kita termasuk industri andalan, ada paket ekonomi ke-11 ya tentang pengembangan industri farmasi dan alat kesehatan, kemudian Inpres nomor 6 ya tentang percepatan pengembangan industri farmasi dan alkes, juga Permenkes nomor 17 tahun 2017 tentang rencana aksi pengembangan industri farmasi dan alkes. Jadi ada roadmap tentang pengembangan industri di Indonesia gitu ya. Jadi kalau kita lihat targetnya 2025 itu 700 triliun dan kita punya 4 pilar Bapak Ibu. Jadi ada biopharmaceutical, ada vaksin, ada natural dan chemical base. Jadi ingin ditingkatkannya itu di natural dan biopharmaceutical. Kalau vaksin termasuk yang sudah sangat stabil ya. Nah, yang chemical itu sudah banyak industri yang terlibat dan kita ingin meningkatkan terkait dengan biopharmaceutical dan natural. Jadi ini adalah peraturan-peraturan yang mensupport perkembangan industri farmasi. Nah, kaitannya nanti gitu ya dengan obat-obatan yang akan dikembangkan tentunya di Indonesia karena tadi inovasi kita masih terbatas, oleh karena itu paling penting adalah kita membuat satu biosimilar. Sebenarnya ini adalah biological generic ya, tapi ini memang tadi saya sampaikan sulit sekali membuat molekul kompleks biologik ya dari produk biologi ini. Nah, ini ada patent of opportunity, jadi ketika patennya sudah off, kita boleh mengembangkan dan menjual ya obat-obat tersebut di masyarakat, di pasaran. Sehingga kalau kita lihat di Indonesia itu memang paling banyak pengembangannya itu di EPO. Kemudian insulin masih fill and finish, kemudian ada growth hormone, dan tetapi pengembangan monoklonal antibody itu masih sangat terbatas ya di Indonesia. Jadi ini kesempatan juga teman-teman di universitas untuk melakukan penelitian dan riset-riset di bidang biological product ya. Jadi kalau kita lihat ini adalah dari data Pharmalkes, ini adalah biopharmaceutical yang menjadi target di Indonesia sampai tahun 2025 ini yang masih belum tuh misalnya monoklonal antibody dan insulin analog. Tapi beberapa juga obat yang ada di sini masih terlambat juga ya, sampai misalnya blood fractionation. Sampai hari ini juga belum ada industri yang mengembangkan blood product. Nah, kemudian ada juga roadmap terkait dengan vaksin. Diharapkan nanti misalnya di 2025 sudah ada HPV atau Human Papilloma Virus Vaccine, ada new TB rekombinan. Nah, untuk natural banyak juga natural dan kita targetkan pada obat-obat untuk antimikroba, antibakteri, misalnya juga anti malaria ya. Nah, Bapak Ibu, jadi ini juga didukung oleh rencana induk riset nasional 2017 sampai 2045. Jadi kita itu di farmasi itu sangat beruntung karena kita termasuk yang didukung oleh RIRN ya di dalam risetnya untuk kesehatan dan obat khusus ini. Jadi teknologi produk biofarmaseutika termasuk penguasaan produksi vaksin, sel puncak, biosimilar, produk darah, dan termasuk juga teknologi alat kesehatan. Jadi pengembangan in vivo diagnostik gitu ya, IVD untuk deteksi penyakit infeksi maupun penyakit generatif dan pengembangan alat elektromedik. Dan tentunya adalah teknologi kemandirian bahan baku obat, baik bahan baku obat yang natural maupun bahan baku obat kimia. Nah, kita tahu bahwa pengembangan vaksin ini tadi kompleks dan waktunya sangat lama. Tentunya industri itu lebih senang ya, investmentnya itu pada saat fase development, di mana teknologi readiness levelnya itu sudah mencapai teknologi readiness level 7 sampai dengan 9. Nah, oleh karena itu memang untuk discovery dan riset ini adalah bagian dari teman-teman kita di industri, di universitas dan lembaga riset ya. Jadi apa yang dilakukan oleh Bio Farma dan farma industri di seluruh dunia adalah melakukan model innovation ya, yang sifatnya open innovation strategi, ada yang knowledge integrator, ada knowledge creator, ada knowledge translator, dan knowledge leverager. Ini tergantung dari innovation manajemennya yang dilakukan serta proporsi dari R&D project yang diakuisisi atau di-acquired ya. Nah, Bapak Ibu, kita juga ada kerjasama Bio Farma gitu ya dalam rangka pengembangan beberapa vaksin dan obat gitu ya. termasuk stem cell itu dalam satu konsorsium nasional. Nah, UGM juga terlibat banyak di sini. Kita juga bekerja sama dalam pengembangan EPO, dalam pengembangan kemudian ada pengembangan stem cell gitu ya, dan terutama adalah vaksin rotavirus ya. Kemudian juga kita punya banyak kerjasama internasional yang sangat penting kita lihat ini sebagai bagian dari salah satu open innovation di industri ya. Nah sekarang yang menjadi pertanyaan mungkin adalah berikutnya adalah healthcare industry ya after COVID-19, apa yang terjadi. Jadi ketika COVID-19 itu telah salah satunya merubah paradigma ya secara fundamental terkait dengan rapid vaccine development. Jadi yang tadinya vaksin itu dikembangkan antara 6 sampai dengan 11 tahun gitu ya, kita bisa dalam kondisi paradigma outbreak seperti ini, pandemik, itu bisa mengembangkan vaksin antara 1 sampai dengan 1,5 tahun ya. Nah ini tentunya syaratnya adalah track record pengembangan vaksin pada saat pandemik, kemudian teknologi rapid response, kemudian ada parallel dan global response gitu ya. Jadi kita menggunakan sistem multicenter dan paralel dari clinical trial. Kemudian tentunya ada relaksasi regulasi dalam bentuk emergency use authorization yang dikeluarkan apabila vaksin itu sudah aman, punya kualitas dan juga punya efficacy gitu ya. Nah, ini sekarang sudah menjadi tren yang kita sebut sebagai rapid response pipeline. Bagaimana kita bisa mengembangkan complete pipeline itu 12 sampai 18 bulan ya. Jadi tentunya ini perlu kerjasama yang baik dengan research institute, dengan lembaga universitas yang memiliki kapasitas terhadap teknologi ya. Jadi acquire teknologinya itu dari lembaga riset, dari universitas. Bagaimana Oxford University itu mengembangkan vaksin adenoviral, kemudian diserahkan ke AstraZeneca untuk dapat diproduksi secara massal ya. Nah itu kita perlu kerjasama yang baik di antara universitas dan industri. Jadi dari mulai antigen production, kemudian preclinical yang biasa dilakukan di universitas. Nah stage 2 ini sudah mulai dilakukan oleh industri ya sampai ke stage 3 ini. Tentunya ada syarat-syarat bagaimana 12 sampai 18 bulan ini bakal tercapai gitu. Dan ini adalah beberapa platform teknologi di Indonesia yang sudah dikuasai untuk vaksin. Jadi ada yang mengembangkan di dalam konsorsium, juga ada yang mengembangkan whole inactivated virus. Jadi UNER kerjasama dengan Biotis, kemudian Bio Farma bekerja sama dengan Eijkman untuk protein subunit. UGM juga mengembangkan protein subunit, termasuk juga ITB, ada juga virus-like particle gitu ya. Nah ini tetapi ada beberapa next generation platform yang kita perlukan gitu di industri yang harus kita kuasai, yaitu viral vector, DNA, RNA, dan antigen presenting cell ya. Nah ini yang menjadi interest industri terutama di Indonesia untuk menguasai teknologi-teknologi ini dalam rangka rapid response terhadap pandemi. Nah, ada beberapa future healthcare juga yang nanti menjadi teknologi tren gitu ya. Jadi ada telemedicine gitu ya, kemudian artificial intelligence tadi sudah dibahas, ada data science dan predictive analysis, ada cloud computing healthcare dan the internet medical of things, juga ada virtual, augmented and mixed reality dalam healthcare ya. Nah, Bapak Ibu, jadi kalau kita lihat ternyata ada shipment ya, ke depan itu akan ada shipment dari tradisional biofarma ya. Jadi prevention misalnya untuk prevention and early detection. Jadi vaksin itu sekarang sudah digunakan ya, menjadi tren untuk prevent dari disease ya. Jadi karena kita tahu bahwa treatment itu lama gitu ya, jadi pencegahan lebih baik daripada pengobatan. Kemudian ada customized treatment, di mana ini sudah mulai melakukan personalized medicine gitu ya. Kita melihat misalkan pada grup tertentu, pada orang tertentu memerlukan satu obat yang spesifik gitu ya. Kemudian kuratif terapis gitu ya. Ini jadi ini dengan kuratif ini kita bahkan mentreatment gitu ya, mengeliminasi dari begitu banyak resep-resep nantinya ke depan. Kemudian ada digital terapeutik, jadi intervention untuk fokus terhadap modifikasi perilaku sehingga mengurangi keperluan terhadap obat. Dan juga precision intervention. Nah, ini sudah menggunakan sistem robotik, nanoteknologi, tissue engineering ya untuk mengurangi pharmaceutical intervention. Nah, ketiga tren ini mungkin juga harus kita pelajari, teman-teman juga pelajari ya mulai untuk diperkenalkan kepada mahasiswanya karena ini mungkin menjadi tren biofarma ke depannya. Jadi nanti ada perubahan disrupted ya. Jadi teman-teman kalau kita lihat misalnya obat-obat yang biasa dipakai untuk penyakit-penyakit seperti genetic disease sudah mulai dikurangi, nantinya akan menjadi penggunaan gene terapi atau gene editing gitu ya. Jadi perbaikannya cukup dengan 1 kali suntik atau beberapa kali suntik, tidak perlu seumur hidup yang bersangkutan harus minum obat. Kemudian pada beberapa penyakit-penyakit seperti kanker, penyakit-penyakit kompleks lainnya sudah banyak asosiasinya terhadap bagaimana kita memperbaiki lifestyle, memperbaiki juga perilaku gitu ya dengan menggunakan digital therapeutics atau preventive medicine. Jadi kalau kita lihat ini begitu banyak ya yang sudah dikembangkan termasuk stem cell, sel terapi, gene terapi gitu ya untuk penyakit-penyakit ini. Nah, terakhir di dalam slide saya kita ingin bicara tentang inovasi dari pharma R&D ya di dalam healthcare industry gitu. Jadi kedepannya future trennya tentu prevention, diagnosis, treatment, cure, and care. Jadi kita itu pengennya end to end gitu ya, end to end healthcare. Nah itu yang diharapkan dari salah satunya misalnya Bio Farma sebagai holding, kita ingin menyediakan end to end healthcare service ya, dari mulai prevention, diagnosis, treatment sampai cure dan care gitu ya. Tentunya ini memerlukan kerjasama yang baik dengan universitas lewat joint research, joint development, atau bisa melalui transfer teknologi dan atau dengan akuisisi dari R&D center gitu ya. Ini adalah top 10 pharma industry trends innovation yang di 2021 di mana ada artificial intelligence, ada big data analysis, ada flexible production ya. Jadi sudah mulai kita membuat satu flexible manufacturing di mana kita bisa mengembangkan beberapa misalnya zat aktif atau vaksin dalam satu manufacturing site. Ada precision medicine, ada juga curative therapist, digital therapeutic, dan lain sebagainya ya. Jadi Bapak Ibu kalau kita lihat ke depannya di 2030 itu mungkin ini adalah tren pharmaceutical, adalah reverse innovation, ada nanoteknologi, ada personalized medicine, dan 3D printing yang akan semakin penting ya ke depannya dalam penanganan obat. Dalam penanganan penyakit. Jadi di Indonesia itu nanti mungkin gitu ke depannya ada hal yang kita melihat ini sangat akan menjadi tren dan ini tentunya perlu penguasaan ilmu di bidang ini yaitu nanopartikel, formulation technology, ada adjuvan, ada gene terapi, ada tentunya bioinformatik, biosimilar ya, imunoterapi dan delivery system maupun upscaling dari production, jadi bioprocess engineering. Ini adalah ketika kejadian yang COVID-19 terjadi, ini banyak sekali obat-obat kembali ke small molecule ya. Jadi bahkan untuk COVID-19 drugs dan vaksin development, kita paham bagaimana biochemistry-nya, bagaimana viral structure, pathogenesis, kemudian QC development, kemudian tentunya melibatkan proteomics dan metabolomics ya. Nah, therapeutics dalam COVID-19 yang melibatkan molekul besar salah satunya adalah monoklonal antibody ya, anti-IL-6, kita sebut sebagai tocilizumab, dan Indonesia juga belum produksi dan kita sangat-sangat butuh ini ya, kadang-kadang ini shortage sekali. Dan yang tentu yang penting juga adalah convalescent plasma. Jadi convalescent plasma juga digunakan banyak gitu ya oleh para penderita COVID-19, namun ini masih dalam clinical development. Jadi masih fase 2 dan 3 dari clinical development. Namun kita juga bisa membuat plasma jadi hiperplasma gitu ya, dikumpulkan dari darah-darah yang para penyintas COVID-19, lalu kita murnikan dan kita purifikasi, dan itu bisa digunakan sebagai satu treatment untuk COVID-19. Nah, ini beberapa obat yang masih dalam clinical trial, dan kita salah satunya misalnya Ivermectin yang memang sekarang masih menjadi pro dan kontra dalam penanganan COVID-19. Nah, Bapak Ibu, salah satu juga yang penting juga adalah polimer. Itu merupakan satu kesempatan buat teman-teman juga untuk bekerja gitu ya, untuk beraktivitas dalam riset yang memang sangat diperlukan di industri. Misalnya kalau di Bio Farma kita butuh sekali polimer untuk vaksin adjuvan, kemudian polimer untuk penghantar atau delivery system untuk vaksin maupun obat gitu.
I'm
ya,
sorry. Oh, finish.
Ya,
Okay.
Sehingga ini terima kasih atas perhatiannya. Thank you for your kind attention, and back to Pak Nofrizal.
Okay.
Waalaikumsalam
warahmatullahi wabarakatuh. Dr. Neni, thank you for your nice presentation. Maybe I will go through to Professor Agung Hendro Nugroho because this is the last speakers of our session. Professor Agung Hendro Nugroho is Dean of Faculty of Pharmacy, Gadjah Mada, Universitas Gadjah Mada, and now he will talk about the Merdeka Belajar Kampus Merdeka, the Freedom of Learning, the program that initiated by the Indonesian Ministry of Education starting from last year. Professor Agung, time is yours.
Okay, thank you very much, Pak Nofrizal. I would like to share my slide. Okay, it is clear, Pak Nofrizal?
Yeah, it's clear. Okay.
Okay, I use stopwatch. Okay, thank you very much, ladies and gentlemen. Assalamualaikum warahmatullahi wabarakatuh. Today I would like to present development of pharmacy higher education in Indonesia, and I focus on implementation of independent campus freedom to learn. Ladies and gentlemen, maybe Dr. Neni and Dr. Yan already explained more. Yeah, I would like to skip many slides. Yeah, because already explained by Dr. Neni. Yeah, ladies and gentlemen, firstly, I would like to describe the pharmaceutical map in Indonesia. About hospitals in Indonesia, the number of public hospitals is about 891. However, a private hospital is about 1,645. And the number of teaching hospitals is only 9, and the number of primary care facilities in Indonesian name Puskesmas is about 9,700, yeah, around this one. And about pharmaceutical company, the number of drug company is about 254, yeah, all with GMB, excluded Jamu and herbal medicine companies. And the number of apothek or pharmacy is more than 22,000. And the number of drugstore is about 10,000, ladies and gentlemen. Yeah, ladies and gentlemen, it is the ratio between the number of pharmacists to the total population. In Indonesia, the ratio of pharmacists to population is 1 to 3,000, and based on WHO, yeah, WHO recommended the ideal ratio between the number of pharmacists to the total population is 1 to 2,000, and the highest ratio of apotheker, yeah, is in Bali, Yogyakarta, daerah istimewa Yogyakarta, special region of Yogyakarta, Bengkulu, Gorontalo, and special region of capital of DKI Jakarta and Sulawesi Tenggara, with ratio of 1 to 2,000. Ladies and gentlemen, now I would like to describe the Indonesian pharmacy higher education briefly. These are 4 levels of pharmacy higher education. Based in the existing program and nomenclature from the Ministry of Education and Culture, there are 4 study programs of bachelor program. These are pharmacy, clinical and community pharmacy, and the last one, pharmaceutical sciences and technology. And based on the International Pharmaceutical Federation, FIP, there are only 2 major in pharmaceutical education. The first pharmacy and the second one pharmaceutical science. So that Association of Indonesian Higher Pharmacy Education last year proposed to Ministry of Education and Culture to simplify nomenclature of a bachelor program, only a pharmacy and the second one pharmaceutical sciences. Yeah, I would like to skip this one, ladies and gentlemen. Okay, yeah, because I have only limited slide. Yeah, ladies and gentlemen, now we are facing the era of a 4th industrial revolution. We can survive in that era if we have literacy skills. Yeah. We also have to prepare pharmacy education with literacy skills of 4th industrial revolution, so that the pharmacists can survive in this era. These literacies of Internet of Things, including technology of information, big data analysis, and soft skills, including networking skills, leadership skills, and communication. Yeah, this one you can see here, ladies and gentlemen. Yeah, in Revolution Industry 4.0, Internet of Things become very important. Yeah, can revolutionize the industry, including technology, process, and people. Okay, this one, Internet of Things for Pharma 4.0. It is very important in Pharma 4.0. Okay, this one, millennials life in digital ecosystem. Yeah. So that in the 4.0 industrial revolution, Internet of Things, digital culture, and soft skill are very important. Okay, I would like to skip. Yeah, this one is about implementation of combination among Internet of Things, big data analysis, digitalization to create smart pharmaceutical factory, including pharma manufacturing. Okay, I would like to continue in this slide. Ladies and gentlemen, the era of 4th industrial revolution is very related to education 4.0 that emphasize an innovation producing education rather than knowledge producing education. If talk about innovation, it is including knowledge and also skill development. So in education 4.0, we emphasize not only knowledge, but also emphasize innovation. It is different with education 3.0, only focus on knowledge producing education. Yeah, ladies and gentlemen, now I would like to describe the change in Indonesian pharmacy higher education. I would like to tell you about the development bachelor pharmacists in Universitas Gadjah Mada. Formal pharmacist education was established in 1946, yeah, and then in 1974, semester credit system was implemented, and then 1980, yeah, 3 levels of pharmacist education was implemented, ladies and gentlemen, and then 1987, yeah, 2 levels of pharmacist education implemented, and then 2001, yeah, there are 2 interests, yeah, in bachelor program, yeah, consists of pharmacy science and technology, FST, or community pharmacy and clinical community pharmacy and clinical pharmacy. Okay, yeah. So total credit in bachelor program, yeah, 146 credits. And then 2003 until 2011, yeah, there are 3-4 interests, yeah. Pharmacy, science and technology, community and clinical pharmacy, and we added one interest, namely natural product or pharmaceutical natural product. But in 2017, ladies and gentlemen, we implemented competency-based education. We go back to generalist pharmacy, so there is no interest in our curriculum. And in this curriculum, we strengthen soft skill in our curriculum, and we implement yearly exposure, yeah, and we implement outcome-based education, and also how to say, we teach to our students about digital transformation, yeah, because in the era of 4.0 industrial revolution, ladies and gentlemen, digital transformation is one of literacies, yeah, main literacies. And last year, we implemented concept Merdeka Belajar Kampus Merdeka. Yeah, ladies and gentlemen, I would like to say this one. Okay. Yeah, ladies and gentlemen, yeah, it is a brief explanation about pharmacy education program, including bachelor program and pharmacist program. Yeah, for example, admission requirement, yeah, high school graduates, yeah, 12 years education, and average age of 18 years. Selection process, yeah, we use national examination, yeah, public universities, and local examination for private universities. And the length of study, yeah, for bachelor program or bachelor in pharmacy is about 4 years, yeah. But some extraordinary student can, how to say, can finish 3.5 years, and then continues to 1 year for professional course, yeah. And degree awarded, yeah, bachelor degree in pharmacy, yeah, BSc, in Indonesia name is Sarjana Pharmacy. And for professional program, the degree awarded is apotheker or apothecary. Yeah. And before graduated as apotheker, yeah, ladies and gentlemen, the students have to pass national competency examination, yeah, exit exam, yeah, including CBT, computer-based test, and OSCE. Yeah, ladies and gentlemen, it is skills needed in 21st century or industrial revolution 4.0. Okay, among these literacies, yeah, ladies and gentlemen, I would like to emphasize the most important skills, yeah. Skills number 4, yeah. Skill number 4, namely agile and adaptive skills. Agile is an ability to move and change to be better quickly and easily. And adaptive skills is ability to adapt to their environment so that they can adapt, develop their potential, and be success in competition and succeed in the workplace. In order to get agile and adaptive skills, ladies and gentlemen, the students have to learn and practice both academic and soft skills during their study in bachelor and pharmacist program. So during, how to say, study in bachelor and pharmacist program, we teach not only academic, also non-academic, including soft skills and digital transformation to students, ladies and gentlemen. Okay, I would like to continue. Yeah, this one, ladies and gentlemen, yeah, hard skill and soft skill, I already explained you, okay, yeah. Yeah, ladies and gentlemen, I would like to explain you, yeah, how to internalize, yeah, literacies in curriculum, yeah. Since 2017, yeah, we implemented curriculum based on soft skill and competency, yeah, 4 years program, yeah, consists of university basis and soft skills and literacies of 4.0 industrial revolution, consists of digital transformation, to under 3 credits, and soft skills 4 credits. In the curriculum, also there is pharmaceutical contents, based on FAPA, ladies and gentlemen, life sciences, pharmaceutical sciences, pharmaceutical industry, clinical industry, and social pharmacy. We also have thematic elective courses, 7 credits, It is, elective for students, Student can choose the package, consists of research and drug discovery, pharmaceutical society and regulation, traditional medicine, pharmaceutical industry, pharmacy hospital, cosmetics and food, distribution and marketing, and it is elective for students, and we implement yearly exposure in this package, consists of 7 credits. In our curriculum also have free elective courses and thesis work, and beside intra-curriculum, ladies and gentlemen, we have also extra and co-curricular program, co-curricular program, we implemented a soft skill every semester to credit to our students, consists of character building, English communication skill, public speaking, socio-entrepreneurship, professionalism, and leadership, it is 1 until 2 credits per semester. Okay, ladies and gentlemen, now I would like to explain implementation of the concept of independent campus freedom to learn in Indonesian name Merdeka Belajar Kampus Merdeka, initiated by our young minister, Bapak Nadiem Anwar Makarim, Gojek founder, the founder of Gojek, online transportation. He is success in online transportation, so that President Joko Widodo, appoint him to be Minister of Education and Culture, Republic of Indonesia last year, ladies and gentlemen. It is, these are implementation of the concept of independent campus freedom to learn in Faculty of Pharmacy, ladies and gentlemen. There are 8 learning activities related to independent campus freedom to learn in general, especially in Faculty of Pharmacy, consists of student exchange, internship or practical work, teaching assistant, and research, and humanitarian projects, entrepreneurship, independent studies, student community services, To run this concept of independent campus and freedom to learn, ladies and gentlemen, last year we released Dean Decree about implementation of independent campus and freedom to learn in Faculty of Pharmacy, And then last year we got independent campus freedom to learn grant from the Ministry of Education and Culture. In this year, we get similar program, namely competitive fund grants. We get 4.7 billion, and congratulate to PIC Dr. Muti Kawapi, who coordinate this program, so that this year we can implement competitive fund grants to implement independent campus and freedom to learn in Faculty of Pharmacy. And also we strengthen in the strong academic ecosystem and strengthen academic support infrastructure to support the implementation independent campus and freedom to learn in Faculty of Pharmacy, Universitas Gadjah Mada. Ladies and gentlemen, it is about best practice of implementation of independent campus freedom to learn in our curriculum of bachelor program. We have several courses that can be used in implement the independent campus concept, freedom to learn. Why only some courses, ladies and gentlemen? because many courses in our curriculum have prerequisites. Yeah, the subjects or courses, yeah, is continuous with some courses that are difficult to implement the concept of independent campus and freedom to learn. Yeah. So, yeah, we choose only special courses. Yeah, for example, thematic elective courses 7 credit, elective courses 6 credits, bachelor thesis 4 credits, soft skill 4 credits, and maybe community services courses, yeah, in Indonesian names KKN, yeah, 4 credits. So we combine these courses, yeah, become one package, yeah, 21 credits package, yeah, okay, yeah. So we offer to students to implement independent campus and freedom to learn in Faculty of Pharmacy. Yeah, I think I already explained about this, yeah, thematic elective courses, 7 credit, yeah, ladies and gentlemen. Student can choose, yeah, the package, yeah, in curriculum, yeah, consists of research and drug discovery, community pharmacy and regulation, traditional medicine, and yeah, etc. Yeah, so we offer to the student, yeah, choose freely, and they can do internship also, yeah, yearly exposure in thematic elective courses. Yeah, ladies and gentlemen, it is key point of implementation independent campus and freedom to learn, yeah, consists of principle, flexibility, targeted, interdisciplinary, yeah, humanity and digital literacies, and experiential learning. Yeah, this one, how to say, key points of implementation of independent campus and freedom to learn in Faculty of Pharmacy. Yeah, this one, ladies and gentlemen, yeah, design of pharmacy curriculum structure that adopts, yeah, Merdeka Belajar Kampus Merdeka in Faculty of Pharmacy, ladies and gentlemen. Yeah, okay. Yeah. So based on this slides, student can take this program, yeah, independent campus and freedom to learn in the first semester of 4 years, yeah, the last years, yeah, of a bachelor program. Yeah, the program consists of thematic elective courses and elective courses, bachelor thesis, soft skills, and maybe KKN, yeah, community services courses. And in total, for implementation of independent campus and freedom to learn is about 21 credits. Okay. And ladies and gentlemen, in our presentation here, I also want to open, yeah, formally, yeah, ladies and gentlemen, the series of activities, yeah, of competitive fund for implementation independent campus and freedom to learn in Faculty of Pharmacy. Yeah, because we already get the program, yeah, 4.75 billion, and congratulations for the team, yeah, coordinated by Dr. Muti Kawati, yeah, congratulations to implement this. Yes, I hope we can, how to say, succeed to implement these grants to implement independent campus and freedom to learn in Faculty of Pharmacy. And my last slides, ladies and gentlemen, regarding to competitive fund grants, we concerns with SDGs, yeah, consists of health innovation and medicines, quality education, liberty campus program, or independent campus freedom to learn, good health and well-beings. So Faculty of Pharmacy have to focus the first Liberty Campus program and strengthening of pharmaceutical industry. With our targets, graduates have characteristics of excellent and human capitals, yeah, ladies and gentlemen, and have innovation skills. Yeah, it is our targets from competitive funds this year's. Yeah, I hope how to say success to run this program, and we can implement how to say independent campus and freedom to learn in our campus or university. And our conclusion in our presentation, ladies and gentlemen, the first, pharmacy jobs in the future require the integration of pharmaceutical competence with literacies in the fourth industrial revolution. The second, curriculum is one of the main cases in pharmaceutical education. The third, pharmaceutical education must accommodate the literacies of fourth industrial revolutions. For example, big data analysis, digitalization, or information technology and soft skills. Fourth, the key to success for pharmacy students is the integration and combination between academic hard skill and non-academic soft skills. And the last one of our conclusion, implementation of the concept of independent campus and freedom to learn is a must. Yeah, thank you very much. It is my presentation. Wassalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh. Thank you very much, Professor Agung, explaining us about the approach that the Faculty of Pharmacy take for adapting with the new regulation from the government. So now I would like to directly to go to Dr. Ian Larsen first, because it's I think there is one question for you, even though maybe you have already answered in the chat question and answer box. Okay, maybe when I have one questions also about the Pharmatopia, and maybe you can also answer the question even though you have already answered in the question and answer. So maybe you can tell us how you develop this Pharmatopia, because it seems that you developed it before the COVID pandemic, right? So okay, please, yes. Dr. Larsen.
Yes. So we developed Pharmatopia more than 10 years ago, okay. Maybe closer to 15 years ago. So quite a long time ago, and quite a long time before, of course, before COVID. So we weren't doing very much online learning at the time. It cost quite a bit of money. We needed to get a university grant to do it, and it cost maybe about 10,000 Australian dollars to build, and that was because we needed to employ a programmer who could build what, even though the software was free, since we had to build the laboratory and everything, we had to pay for someone to do that. So it cost about $10,000 to do it. The question in the Q&A, so it was a very good question. It was when you replace hands-on laboratory classes with online learning, online classes, then do you get the same learning outcomes? And generally, I think the answer is no. Generally, we want students to have the experience in the laboratory using the equipment, and so then they're learning the physical skills to manipulate the equipment, whether it's beakers and pipettes or making a cream or an ointment or whatever the laboratory skill is. Then if you just watch things online or interact with things online, then you're not learning that physical skill. And so therefore, I don't think the learning outcomes are as good. That's in general. In this specific example, then, as I said, because the limitations of doing the tablets at Monash at that time, the students couldn't use the equipment themselves, they could only watch somebody. And since they're only watching someone else, then they're not learning any physical skills. So then they may as well be just watching a video because it's just purely observation. And also, as I said, not being able to use a real active ingredient, et cetera, et cetera. But the main one was watching somebody else. So they weren't learning any physical skills. And so therefore, this was an opportunity for us to create a better learning activity online than in a laboratory. But I agree that generally replacing laboratory classes with online classes is not as effective, but in this case it worked well.
Okay, thank you, Dr. Ian Larsen. So now I think we have one attendee who raised his or her hand. Maybe Mr. Edinur, could you hear me? Hello? 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 Mr. Edinur, are you going to ask questions to the panelists? Okay. I don't know. Okay, we wait. Okay, next, maybe we go to the next question for Dr. Neni. Dr. Neni have two questions. One is how is the roadmap for developing raw material independent country from Mr. Agus Winarso, and the next question is from Mrs. Marlene. Is it? Do you have any comments to formulate the solid dose form for biological products? Okay. Okay.
Pak Nafrizal.
Hi.
Yes, thank you for the question from the audience. So first about the I think about the import, import of the raw material, So I think the important thing is the innovation ecosystem. So we have to promote the collaboration strategy between the university or R&D research and also the industry. And the thing that very important also the support from the government. So we see that we have the roadmap from the Ministry of Health for the drugs and vaccine or chemical drugs development. So the support from government, including in also regulation and also the, for example, regulation to support the national product, such as local content preference, Pak. Like we call it TKDN, tingkat kandungan dalam negeri. So it will be boost the research and development in Indonesia for the raw material production. And also flexibility in regulation, and of course the funding in research development, that's very important in innovation ecosystem. I think the important thing is also we have to promote local herbs and natural ingredients, in order to maybe we can change the import dependency to other raw material from outside of our country. And that's our my answer for the first question. And then the second question is formulation of the solid dose, for the
biological materials, for example, monoclonal antibody.
Okay. So in most of the monoclonal antibodies is in injections, because of the mechanism of action. They need to be we have to deliver it intravenous usually, and then what we do is that because of the monoclonal antibody is not stable in liquid phase, what we do is we use the freeze dry process to get it into the solid, but not in the usually not in the tablet or in the solid dose, but in the injection or by liquid. I think that's my answer to Dr. Miss Marlene.
Okay, thank you very much for your answer. I hope it answered Dr. Marlene's question and also Mr. Agus' questions. Okay. One last question maybe from Dr. Edinur. So for all the panelists, is it possible that a new variant of COVID or COVID-like pandemic will happen again in Indonesia or in the globe?
So Pak Nafrizal, maybe
okay. Okay, please, Dr. Neni first, maybe. Okay, please.
So first, that in January 2020, the Wuhan strain is announced by China's government at that time, and then it almost all the country has a Wuhan strain for the COVID-19, but because of the this is the viral RNA. Usually it will be mutate, and then because of the several immune response from the host, drugs, and environment, so it will be a chance for this RNA virus to be mutated all the time. So right now we have 4 virus on concern by WHO. It's called the beta, gamma. So we have alpha. Alpha is the big one, 172 from the UK, and then beta is from the South Africa, and then gamma from the Brazil, Japan, and also delta from the India. The last that very concern for us because of the this viral is spread quickly in the population. Yeah. So the delta is one of the variant of concern by WHO. So it needs maybe the vaccine that right now developed is less effective, but according to the WHO book and then regulation, they said that we have to use this vaccine to stop the spread of the virus to the population. So either that this vaccine is less effective. Yeah. So WHO and all the panelists, we have weekly a meeting to discuss about how to develop the vaccine against these variants. So protocol is most important than vaccine right now. Yeah.
Protocol is more important.
Yeah.
Okay. Okay, maybe Dr. Ayan, would you like to add us some information to the questions?
Only that in the chat I posted a web link where if anyone would like to try the tablet lab, the SCORE module, then it's free to use and you can download and use it as you want. If you're not familiar with this kind of module, you might want to speak to any faculty or university IT people who might be used to this kind of thing, but you can also reach out to me, and in a later message I posted my email address, so you can always contact me and just email me and ask for help, and we can have a Zoom meeting or something if we need to, but I'm completely happy to help anyone who wants to use that module. Also, if people want to have a email discussion or a Zoom discussion around going around developing tools, activities or something, and the processes that I used, and then also I'm completely happy if people reach out and email me, and we can do it via email or via Zoom or however it works. So please don't think that the end of this session is the end of contact. Feel free to reach out to me and ask any questions you have, and we can work together or however we need to hopefully help you in what you're trying to do.
Okay, thank you, Dr. Ryan. I think that's a very good news for the attendance of this meeting. I think there are so many people that want to try to develop something in this pandemic era, especially for their students. Okay, maybe next, Professor Agung, maybe you want to add something to the questions.
Yeah,
from
I think explanation from Dr. Neni and Dr. Jan Larsson is very enough, Pak Nofrizal.
Okay.
Just one sentence. We have to learn in India case that there is mutation from India, and the mutation is very infectious. Okay.
Okay, thank you very much, Professor Agung. So, okay, before we close, before I return the time to the Mrs. Farida, so I would like to maybe summarize a little things here. So from the first session and the second session of the seminar today, we see that the collaborations between university and industrial pharmacy and community is very important to make our student graduate can be directly fit with the job or career outside, and also the use of the technology that as shown by Dr. Ryan when he and his team developing Pharmatopia we can see that it's very useful in this pandemic era, even to the idea is come out far before the pandemic era. So I think even we hope that the pandemic soon will be stopped. I hope that the development of the software or curriculum will not be stopped because the pandemic finished. Maybe that's all from me and the panelists. I return the time to Ms. Farida, please.
All right, thank you, Mr. Nafrizal, PhD, for guiding us on our second session of webinar. And thank you very much for all the speakers in the second session with the excellent topics and experience had been shared. All right, and we are going to take a picture one more time for all the participants and speakers of today's seminar. Please turn on your camera and hold for a moment. All right, the picture will be taken by Dr. Adiatmika. So everyone is ready? All right, I will count it in 3 seconds. Okay, 1, 2, 3. And one more, please. 1, 2, 3. All right, thank you, ladies and gentlemen. All right, and well, we have come to the end of our webinar. I would like to thank everyone who made this meeting possible, and I thank to all the speakers and for your presentation and sharing. That's very wonderful for today. And thank you all once again for coming, and we hope to see you again next time. Good evening and thank you. Thank you.
Hi, everyone. Thank you.
Hi.
Thank you, Dr. Larsen.
Thank
Thank you,
you.
Bu Neni.
Dr. Ria,
Nice to meet you all.
Tarsyan, and also
Dr.
terima kasih
Agung,
Bu Neni.
Triana ya.
Sampai ketemu.
Ya, Pak Nafrizal ya. Sampai
Terima kasih Bu
ketemu,
Neni,
Pak Farida ya.
Pak Agung.
Terima kasih, Bu
Ya,
Neni.
terima kasih. Bapak Ibu panitia sukses selalu.
Ya.
Terima kasih buat tim. Selamat ya.
Mohon izin live ya Bapak Ibu.
Mohon izin live ya.
Mohon izin live. Ya, monggo. Assalamualaikum.
Udah lah nih.